Assembly, Senate Chamber, Programme Sound.
Thank you, and I declare the meeting open to the public online. Can I welcome all members who are participating by video conferencing today, and can I remind members about the protocols regarding the use of electronic devices? Members will be aware that there is a unison event on at 1 p.m. today outside Parliament buildings, and I would hope to be able to conclude the meeting today by 1 p.m. to allow members to attend if they wish to do so. The Minister, members, is due to join us at 9:15, so in that case I propose we take item 6, which is the Health and Social Care Bill report now, and then take the briefing from the Minister. Would members be content with that approach? Yeah, thank you, members. So moving to item 6 then, Health and Social Care Bill Agreement and Report. Members, we will now formally consider the final draft of the committee report on the Health and Social Care Bill, and agreement will be sought on each of the sections. A copy of the final report, as agreed at Tuesday's meeting, is at tab 6.3 of your table papers. I refer members to the title page, the table of contents, and the committee powers and membership at pages 8 to 10 of your tabled pack. Are members content with this section as drafted? Yep, members content, thank you. I refer members then to the executive summary, which is at pages 11 to 13 of the table pack. Are members content with that section as drafted? Yep, content. Thank you, members. I refer members then to the introduction and committee approach at paragraphs 1 to 15 of pages 14 to 16 of the tabled pack. Are members content with this section as drafted? Thank you, members. I refer members then to the consideration of the bill, which is at paragraphs 16 to 134 of pages 17 to 45 of your table pack. Are members content with this section as drafted? Yep, thank you, members. And I refer members to the regulatory powers in the bill at paragraphs 135 to 139 of pages 46 to 47 of the table pack. Are members content with this section as drafted? Yep, members content, thank you. So I now refer members to the clause-by-clause consideration of the bill at paragraphs 140 to 159 of pages 48 to 52 of the tabled pack. Are members content with that section as drafted? Yeah, content. Thank you, members. I refer you then to the appendices at pages 53 to 60 of the table pack. Are members content with this section as drafted? Yeah, thank you, members. Are members content that the minutes from this meeting are approved by the Chair so that they can be included as part of this report? Yeah, thank you, members. And are members content for committee staff to make any necessary formatting changes in advance of electronic publication? Yep, content. Thank you, members. So moving then, members, to the publishing of the report. And I want to now put the question that the Committee for Health is content for the report on the Health and Social Care Bill to be published. Members content? Yes, thank you. And members, would you also be in agreement that we issue an electronic copy of the report to organisations and individuals who provided evidence to the committee and to the Department of Health? Members content? Thank you, members. Okay, members, so I'm just going to check with Clerk then. Do we have...
Not yet, Chair, so if you want to go on the Chair's business, matters arising in minutes, maybe?
Yep. Yep. So, so we'll go on then to apologies. Any apologies, Clerk?
None received, Chair.
And members aware of any apologies? No. Okay, thank you. In terms of Chairperson's business, members, I just want to reference an event that I attended last night around acquired brain injuries. A very well attended and a very interesting panel discussion. There was a clinical lead from the Belfast Trust there in relation to acquired brain injuries, as well as other members on the panel. Significant concerns were underlined in terms of support, in terms of awareness of acquired brain injury, both within children and within adults, and awareness of the supports needed and the wide range. But I thought it was a very useful event in terms of starting to address and trying to come up with some of the solutions, and I just wanted to refer members to that and to thank the organisers for inviting me to that as Chair. So thank you for that. Moving on then to the draft minutes, members, I refer you to the minutes of the meeting of the 23rd of September, which is at tab 4.1. Are members content with those minutes? Yep, content. Thank you, members. I also refer members to the draft minutes of Tuesday's meeting, which are at tab 4.2 of the table pack. Are members content with those minutes? Yep, thank you, members. And there are no matters arising, members. So thank you for that.
Move on to correspondence.
Yeah, so we could move forward then to correspondence, members. So, correspondence there, members, is at tab 9 of your pack, and there's a couple of items just that I want to draw to members' attention. First of all is item 9.3, which is a departmental response advising that work on the Adult Protection Bill is ongoing and the Department plans to introduce it early in the next mandate. Would members be content that we write to the Department to request further information on the prioritisation of primary legislation in the next mandate, so we can get an idea of the Department's plans for other legislation? Yep, thank you. Item 9.4 is a departmental update on the work of the Department and RQIA on the neurology issue. Are members content to request a written briefing from the inquiry on progress and the timeline for publishing the inquiry? And members, any, Carol, I think, and then I see Paula indicating.
Okay, so given the regulations in the Spotlight programme, I think it's really timely that we do ask for Brett Lockhart to come to the committee, because some of the allegations that were raised in that programme, and they are allegations, are very concerning. But what I do know is, even from talking to some of the former patients of Dr. Watt and indeed their families, there is a crisis of confidence and there's a lack of trust. And given that we spoke about duty of candor and everything else, I think it's completely appropriate at this stage that we invite them into the committee.
And Paula?
Thank you, Chair. I was just going to raise or suggest the same thing as Carol there. I think we all watched that programme during the week there and were absolutely aghast at some of the allegations that were raised. I have had a lot of correspondence from patients, not just in South Belfast, but others that I've been supporting over the last few years. They are deeply distressed. I suppose they want to get to the bottom of this. They want their own diagnosis properly treated, etc. But they also want to be assured that the consultant himself has been held to account. So I think we need to get the panel from the inquiry here as soon as possible. Thank you.
Thank you. So, members, I think there's a proposal that we asked for the panel to come in. Would members find it useful if we got a written briefing as well, so that would inform probably our scrutiny in terms of in advance of the scheduling issues that the clerk would need to deal with there, and as to how that meeting would happen. So members content with that? Yep.
Yes, Chair.
Okay, thank you, members. Any further comments to make on any other items of the main correspondence, members? No. Are members therefore content with the actions on the correspondence list for the remaining items? Yeah, thank you. So members, moving on to table papers, I draw your attention to correspondence from the Department at tab 9.15. The Department is advising that it will be bringing forward 4 separate legislative consent motions asking the Assembly to agree to provisions that deal with transferred matters within the Health and Care Bill. The Clerk will work with the Department to schedule briefings on these LCMs, and I certainly for one would welcome that, because I think these are issues that we need to give really careful consideration to, and so a briefing on those would be very useful. So are members content that the Clerk works with the Department to schedule briefings on those? Yep, thank you. Do members have any other comments in relation to the tabled papers? No, thank you. Okay, members. So moving on then, members, to the Forward Work Programme. I refer to the Forward Work Programme, which is at tab 10.1 of your packs there. Are members content to note? Yep, okay, thank you, members. Okay, so I propose we maybe take a short break just to get the Minister on the line, and then we'll go straight to that briefing as soon as we can get the Minister. So just a minute or two of a break, hopefully, and we'll have the Minister on the line, members. Thank you.
This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound.
Okay, that's us live now, Chair.
So thank you, members. We are now moving to our ministerial update, and we're this morning receiving a briefing from the Minister of Health and the Chief Medical Officer. So we now go to the briefing, and I now, first of all, like to welcome Mr. Robin Swan, Minister of Health. Can you hear us this morning, Minister?
I can, Chair, yeah.
Thank you. And the Department has advised the Chief Medical Officer, Michael McBride, will join the meeting around 9:45 a.m. So I'd like to ask you then to go ahead, Minister, and brief the meeting. I'm conscious that it's been quite a while since you were here and there are a lot of issues, but there are a lot of members' questions, I suppose, so if I could ask you to keep your opening remarks as succinct as possible, and then we'll go straight to questions and answers. Thank you.
Certainly, Chair, and good morning, and as ever, thanks for the opportunity to update the committee, and as you say, I'll keep my opening remarks short to allow more times for questioning.
Sorry,
I think since
just your camera's not on there, Minister, so maybe if you could just check that. We're not seeing you.
It's again, I think with this problem the last time, Chair, when we met.
Yeah. Well, do you want to go ahead? Ahead and start the opening remarks and see if you can get somebody there
we will, Chair, thanks.
Okay, thank you.
And I'd say, Chair, I think I attended the Health Committee on the 8th of July, and we have made progress in a number of areas. At present, we've delivered 2,520,000 doses of vaccine. 89% of the adult population have received their first dose. 83% of the adult population is what classified as fully vaccinated. We've moved into our 16 to 17-year-olds, and we've delivered 22,000 doses, 48% of, again, that eligible population. We have not yet been advised by JCVI on where or when or if there will be a second dose for 16 to 17-year-olds, so we keep that under review. We've already vaccinated up to 10,000 of the 12 to 15-year-old population with specific underlying conditions, or who live in the household with a person who is severely immunosuppressed, and the main vaccination of our 12 to 15-year-old age group will commence in schools later next month in October. And last week, the booster programme commenced in our care homes for residents and for staff, and the wider booster programme will commence in October for those who in the JCVI groups from 1 to 9 who are at least 6 months from their second dose. So these figures, Chair, as I'm sure you and your members will agree, are a credit to our citizens who have come forward and helped in the fight against COVID by getting their vaccine, and to those involved in the vaccination programme. Chair, additionally, Ronapreve, a drug, will be available for hospitalised patients with COVID-19 from this week. This is a new treatment. It's incredibly welcome, and it will benefit some of the most vulnerable patients in our hospitals. And alongside the success of our vaccine rollout, the development of new therapeutics is an important step in saving lives and protecting our health service, and again fighting back against COVID. Chair, the Executive has reviewed and lifted a number of restrictions over the summer, and we will finalise our autumn and winter COVID contingency plan at the Executive meeting on the 7th of October. As I've stated previously, we're heading into what is normal winter pressures, which always puts our health service under pressure, but that, coupled with COVID, will put it under additional pressure. So we need to take decisions now to ease that pressure, and getting vaccinated is one of those. And that is why I would like to take this opportunity to again ask the public to get their first and second vaccine, and if eligible, the booster dose. Every single person taking the vaccine makes a difference, and the more people who are vaccinated, the less people who will end up in hospital. So I'll just say, and as members have reiterated, continue to wear your face coverings, wash your hands, and when meeting people indoors, ensure the space is well ventilated, and help us to help our medical and healthcare staff to get through this winter by keeping yourself safe. And I'm happy to take questions now, Chair.
Okay, thank you, Minister. And we're still not seeing you there, so hopefully we can get that, because it obviously helps with just the timing of things if we can see you there. So listen, I'm going to try and keep my questions really short, and appreciate if you can do the same, because I understand the members after this period of time will have a lot of issues to raise. As you say, it's been the 8th of July, and there's been a lot of issues in there in the intervening period, including continuing high rates of transmission, severe pressure on frontline staff, and staff being brought in from leave, and those are areas obviously of huge concern. My first question, Minister, is on the issue of independent and private and agency staff, health and social care workers' COVID payment, the recognition payment. How many staff are working within the independent sector that qualify for that payment?
We don't have those exact figures yet, Chair, and that's the piece of work that continues to be undertaken with the different employers at different stages. We in Northern Ireland, as I said at question time on Tuesday, there's a large number of smaller employers, so we need to get those numbers verified. I can update the Committee of Health and Social Care Workforce. We have paid over 83,000 core staff in regards to that, and that equates to over £55 million. So the gathering of the data of who's eligible and what level of payment they'll be eligible for as well is the piece that's taken a longer period of time. We're engaging still with employers and trade unions as well. Part of the challenge as well, that if we supply a payment to an employer, we need to make sure there's a mechanism in place that it actually goes to the employee that is entitled to get it.
And do you understand, Minister, the frustration of staff on the ground, given this was announced over 8 months ago, that work they presume would have started along with core staff, that their payment would have been considered at that point? So it is causing significant frustration on the ground. Do you recognise that?
Chair, it's a frustration for me as well, because it's something that I want to see done. I want to see progressed as quickly as possible, and my officials are now immediately on a weekly basis to get that progressed as quickly as we can get it out there as well, because it's only a small token of appreciation and thanks, Chair, but I think it is a token that the Executive committed to pay, and I know that the Committee were supportive in getting out there as well. So we continue to work through the challenges that are in front of us in processing this level of payment to so many employees through so many employers. And I think that's what we need to make sure, because as I said on Tuesday, we also have to be conscious that this is public money as well.
And do you have a timeline, Minister, when you expect or hope that those payments will be processed?
Again, autumn is the date I have been given, Chair. Once I receive a firm date for those processes and payments to start to be made, I'll come back to the Committee and update you immediately, as well as the many individuals who are, I'm sure, Chair, contacting you and the members as well as they do myself.
Thank you. Moving on then, and I have mentioned there the issue of staff being under serious pressure, and indeed staff being brought in by several trusts off leave, and leave which is badly needed. But I want to raise the issue around the parking charges related to that, and just as you know, the fact that at a time when staff are under so much pressure, when staff are being asked to come in to cover additional shifts, that at a time such as that you contemplate reintroducing parking charges. And could you commit, Minister, and we're also conscious that this committee will be receiving a bill in all likelihood around a private member's bill around parking charges. Could you commit to suspending those payments for workers throughout the duration of this pandemic and until that private member's bill that Farmer McCann is bringing has been processed through the Assembly?
It's a piece of work that we continue to review, Chair, because the parking charges that staff pay aren't consistent across all our trusts or across all our sites. So that's something that needs to be worked on and addressed as well. In regards to car parking, during the first phase or the first wave, when we made car parkings free and the initial point, and we were able just to lift barriers, it was also at a point in time where there was a large downturn in activity across our hospital sites. And while these further waves and later waves have seen a number of people in hospital, they've also seen us try to continue as much of our normal activity as possible. Part of the challenge is the restricted number of car parking places that we actually have on our main hospital sites, and how we make sure there's a patient and visitor flow and access to them, what we're actually receiving, as well as the challenges that are being raised from staff in regards to not receiving the free car parking exactly on the site that they're working on. We're also seeing challenges from visitors and from patients who can't get parking places either, and it's because of a restricted number of car parking places at sites. What some of the trusts have implemented and what some of the trusts are actually doing is park and ride facilities. And again, we were able to work in the past with the Department of Infrastructure in regards to supplying some close to site parking facilities for staff. So it's something we keep continually under review, Chair, and I'm aware of Fra's private members' bill as well, which we'll take into consideration when it comes forward.
Surely the workforce could be issued with passes, or some there could be a way found whereby the workforce would be recognised in that sense, and that especially where people are having to cover additional shifts, then you can see I've heard of cases of staff paying up to £60 out of their wages, you know, and that's very, very a significant amount of ordinary workers' pay. So I would appreciate if you could maybe take a look and see if there's some way that we can recognise, as we know we want to retain and support staff, and that may be one very practical way of doing so. Okay, I'm going to move on then to the mother and baby homes, Minister. It has come to my attention that when the co-design forum was being advertised, there were no advertisements within the health department facilities, such as hospitals or GPs. Would you agree that that's an oversight on behalf of the department, given that many older and vulnerable people who are survivors of the institutions would regularly attend those facilities?
Chair, it's not something that has been raised with me prior to you raising it this morning. It wasn't something I was aware of, but I'll take it away. And I know that the independent panel, the panel that was appointed through yourselves and the Executive Office, have done a wide level of engagement and consultations in regards to that work. But it's something I'll take away from you've raised it, Chair, and see if there's something else that we can do in regards to that, even just the awareness of what the current state of play is in regards to that work, to the cohorts that you've mentioned and the people that you've mentioned as well, because the intention, there was no intention to exclude anyone from what is, I believe, to be a vital but sensitive piece of work that the Executive has taken on to consider as well. So I'll take your point on from that, Chair. Thank you.
Thank you, Minister. And a second point then on the mother and babies, it's expected, we know that the Mother and Baby Magdalene Laundry Truth Recovery Panel will publish their recommendations for the independent investigation within the next month. Can you commit to a quick and efficient response to what is recommended in that report?
I'll commit to an efficient response, Chair, because as you know, there is cross-cutting nature between ourselves and the Executive Office in regards to not just the appointment of the panel and the work it does, but also the report that will be published and the next steps taken. That panel, I think, has done a very good piece of work in regards to not only the detail and the engagement, but also the independence that they've taken. So I'll commit to reviewing it fully along with other ministerial colleagues once we do receive it and receive the report in its full and the briefing from. I think we're due to get a briefing from the panel themselves as well.
Okay, thank you. And I know, Minister, you would agree with me that time is of the essence and crucial in relation to the mother and babies, given that many have already been waiting decades and given the age profile of many of the survivors and victims and family members there. Okay.
I fully agree, Chair. And look, it's the nature of the sensitivity of the issue that has been crucial and how that work has been progressed. And I think, again, to reference the work of the panel as well in regards to their engagement processes as well. But taking your earlier comments, Chair, I'll raise that with the panel as well.
Okay, thank you. The RQAA report then, Minister, you published the report into the mass resignations of the board over the summer, and I just wanted to ask you, and there's a lot in that report and a lot to be gone through, but just in terms of one small element of that, did you appoint the interim commissioner?
The interim commissioner for
RQAA, did you make that appointment?
For the RQ, I don't recognise the term RQIA commissioner, Chair.
The interim chief executive.
Oh, the chief executive. No, I didn't. It's not within. Sorry, Chair. Apologies. Yeah. It's not within the scope of the minister to appoint. That would be the remit of the board, and I think that the report itself does take some time and does cover that position as well. Okay,
and did the permanent secretary appoint the chief executive? The interim chief?
I think that when we look at the report itself, Chair, there seems to be an issue as to who actually the appointing authority was and how that was actually come about and what the direct line is, and that was part of the work that we asked. When we asked David Nicholl and his team to look at and whether the accounting officer letter that was issued actually equates to that appointment or not.
And can you commit to giving that information to the committee when you have received that report back?
I will certainly, Chair, because I think that was one of the things that we did, and I gave the commitment in publishing that report and its recommendations in full, and that's what I've done, and I've undertaken to take in the recommendations as they have been printed, but also the lessons learned that can come from that as well.
Thank you. And a couple of final quick ones then from me, Minister. I've been raising the issue about the return to practice and some of the barriers that are in place in getting much needed nurses back into the profession and other professions as well, but taking nurses as an example, the critical need for additional staff and additional help to frontline staff. There are a series of hurdles for a nurse returning to practice, including having to pay for vaccinations, having to buy their own uniforms. But I think a significant barrier is that they have to identify the placement hours, the practice hours, and they have to work those hours free. And that could be up to a period of 10 weeks. And I think that's a significant hurdle. The Chief Nursing Officer did, at a previous committee appearance, agree to look into that issue. And I am aware from statements in recent days that there is a review ongoing. Can you commit that those return to practice hours will be looked at in terms of those being paid for to support nurses back into the profession?
Chair, I know the Chief Nursing Officer in a meeting I had with her did raise the issue that you had raised. There's two issues here.
We've lost your feed there, Minister. We're not hearing you there. You just had finished that there's two issues. But just for those watching in, we've lost the Minister at this point in time. We're just waiting to get the Minister back online.
Do you want to suspend for a minute just while
Yeah. Okay, members, we will suspend there for a minute to allow broadcasting and get the Minister back online. Thank you.
This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed.
Okay, thank you, members. So we're back in public session. Minister, you were cut off there. You were just addressing the issue of nurses having to work return to practice hours free and what could be done about that.
Well, Chair, I don't know where we got to before that actually cut off there.
You just said there was two issues.
Two
Yeah, you just said there was two issues, and that's the point at which you got cut off.
All right, okay. The two issues that we have, and again, I've had the conversation with the Chief Nursing Officer because she made me aware that you had raised it. There is a return to practice process that has to be completed to get back onto the permanent register, and that's as per the Nursing and Midwifery Council. There are new standards in place which have been set by them, where the university providing the programme sets the number of practice hours that are required depending on the length of programme, depending on the length of time the nurse is actually off the register. There's an alternative where the nurse can actually sit the OSCE exam, but that's difficult without professional practice update as well. We pay the fees and have paid the fees at the University of Ulster for any nurse who wants to take that exam. But the other issue, Chair, that the Chief Nursing Officer has highlighted is the temporary register, which has been used also in the past for the workforce appeal, where nurses who have been less than 5 years off the register can go back onto the COVID temporary register. And there's also a conversation now being held that the Chief Nursing Officer is aware of between the Nursing and Midwifery Council and DHSC, where there may be a transition arrangement that anyone who's on that temporary register can go onto the permanent register directly. We're aware there are about 300 nurses with Northern Ireland addresses currently on the temporary register, but we don't know at this point in time how much work they're doing or where they're doing it.
Okay, well, I think it's important. I think I am hearing that that's a significant barrier, and I recognise that it would be a significant barrier. I mean, anyone would struggle to to put those types of hours in, and they're clearly working within the health service when they're doing that. You know, nobody is in there in this day and age. Nobody is in there, including students. Everyone is working, so I think it's only fair that they will be paid, and I think it would facilitate further numbers of nurses to come back into practice. So, okay, thank you. I'll move on then, Minister, just to the issue of the hour number, and where is the hour number sitting at present?
Just one moment, Chair. Our number in regards to hospital admissions, we are just sitting below 1, and we have been there for the last 3 weeks. In regards to positive cases, again, just below 1 for the past 2 weeks, and we continue to make slow progress in that direction.
Okay, and numbers are worryingly high. I see they've sort of gone up again yesterday to 1,320. Is that strategy still in place to keep the hour number below 1?
That is the Executive's policy statement, Chair, in regards to the interactions that are taken at that level, yeah.
But is it your strategy, Minister?
It's the Executive stated position in regards to how we manage the pandemic, so as part of the Executive, Chair, yes.
And do you agree with that?
Yes.
Okay, thank you. And the final one then from me is in relation to the committee had called, again responding to a numerous concerns that were being raised with me and with other members of the committee around workforce pressures. We had asked again that you would convene a summit, a meeting of all those relevant bodies, the Trust Chief Executives, anyone else who would be part of the solution. Can you give us any update in relation to that meeting or how that's progressing?
Chair, in regards to a summit, there, as I think that wider scale meeting, I don't think there's anything in progress yet. But I continue to meet regularly with the trust chairs, all my arm's length body chairs. I met with trust chief executives. I meet with the trade unions, and I meet with the Royal Colleges on an independent basis as well, so that there is that continual input. I'm not aware of any arrangements as of yet to have a large-scale summit-type conference to discuss those details or those conversations that we have, I suppose, on a more focused, intimate basis, where it actually comes to the specifics of the groups that I'm talking to.
Well, I do know that many of those organisations who are experiencing the sharp end of the pressures that have existed over a significant period of time, and which are likely to increase in the time ahead, would welcome such a summit. So I would reiterate that I think that is of benefit, and I'm being guided by that in relation to what I'm hearing from the sectors. Okay, Minister, thank you, and appreciate your succinct answers there. I'm going to go to members now, so I'm going to go first of all to our Deputy Chair, Pam Cameron. I then have Jerry, Carol, Paula and Jonathan, and then I have Orlia as well. And Carol, yes, I have Carol in there as well after Jerry. So I'll go first of all to Pam Cameron. Go ahead, Pam, please.
Thank you, Chair, and thank you, Minister, for your attendance at committee this morning. I suppose just on the back of that last comment around the summit, I think we would all like to see some movement on that, Minister, as you know, the healthcare professionals are calling for such a summit, and I think it would be good to see that happening given the crisis that we're in. Minister, obviously there are still severe pressures on our health service, and that will be ongoing. And obviously there has been a decision to remove social distancing in certain environments. I'm just wondering if you could explain to us how that change in social distancing can be squared off with the pressures that are facing our hospital wards. And obviously I welcome the call for military support, and you might want to update us on that as well. But can you allay fears that such relaxations may, that they won't be reversed coming into the winter months because of the ongoing pressures in our hospitals and services?
I thank the Deputy Chair for her questions. In regard, I'll take them in reverse. Can I assure that we won't have to reverse some of those decisions or bring back those restrictions? No. because I think it would be foolish for anyone to give those levels of commitment when we don't know what's in front of us, especially over the next 4 months in regards to where we currently are, or even new variants as well. So like other health ministers, even across these islands, I think to take anything off the table would be foolish, and I think it would be wouldn't be being honest with the people of Northern Ireland as well, to say, look, we're only going in one direction and we may not. But again, it goes back to the point that I made in my opening comments. Everyone has a part to play in this. Vaccination is a big part in regards to what we need to be, what we can all do as individuals. So again, it's making a difference in regards to positive cases, to hospitalisations, to ICU transmissions as well. So that's one of the big steps. If people are really genuine in regards to where we go and where we keep going, I would encourage everyone who hasn't yet taken their vaccine to get it, and then anyone who is eligible for the booster to get it, anyone who's eligible for their flu vaccine to get it. So all those small steps will help us as we work our way through that. In regards to the MACA request, I'm happy that has been approved again and accepted by the MOD. So we expect to see up to 80 military medical technicians deploy here in Northern Ireland within the next week or so. They will be here for a 4 to 5 week deployment. That's what we've been able to get them for, and they will go in as before to a number of our hospitals to help out on our frontline staff places as well. I want to be clear, it wasn't a political decision. This was a number one priority for me, to save lives and to support and protect our staff and help our staff in the front line. The current situation is different to the pressures in the earlier stages of the pandemic. You know, we've that ongoing serious COVID threat, but that's combined with a growing pressure environment right across the health and social care system. So staff are tired, and what they said to me after we used the military deployment in the first wave, they saw that as actually not just the physical help and relief they got, but they also seen it as a moral boost and a boost to morale, because they saw someone else coming in actually to take some of that pressure off them and help what they do. So as I say, you know, the staff that will come in, they'll be working as nursing assistants under the supervision of a registered nurse, you know, carrying out roles such as monitoring vital signs, nutrition, hydration, part of the running teams in our ICU. But like the last time, they'll provide that comfort and care to patients and assist with carrying out that personal care as well. So it's a welcome relief. In regards to your earlier statements in regards to the relaxations of social distancing in a small number of settings, the decision that was taken by the executive on Monday, I believe it was proportionate to where we are now in regards to the settings that were considered in regards to that, and it was indoor entertainment and our retail sector as well. But I would remind members, and would remind people listening to this as well, there still are mandated measures in place. The wearing of face coverings in Northern Ireland has not been removed, and it frustrates me greatly and it angers me when I see the number of people not wearing face coverings. There are, and I'll acknowledge, there are people in Northern Ireland, there are people in our society who can't wear them due to medical reasons or other reasons, but the large number of people who could and should be wearing them, I would encourage them to do that as well, because like vaccines, they do help us in our fight against the spread of COVID.
Thank you, Minister, for that. And I certainly would agree with you. I would have similar worries about the quantity of people that I'm now seeing out and about inside shopping venues and whatnot who appear to have just completely ditched the mask. I think that is a worrying sign, and I do hope it's not also linked to that kind of anti-vax element that is out there. And I wonder if you want to make a comment on the vaccination rollout. Obviously, it has been hugely successful, but we need more. And I too am not called to ask all those who are able to take a vaccine to do so, and to do so as quickly as possible in order to keep themselves safe and those around them, and also to ease those pressures on our hospital services. But Minister, could you tell me if do you have any update regarding the rollout of the actual flu vaccine, and do you see any knock-on impact from a kind of an anti-vax message towards the COVID vaccine moving on to the flu vaccination programme? And I understand the flu vaccination programme is much larger than it was in recent years, with a larger cohort being invited to take it up as well. But are you seeing, or are you fearful of any issues around the uptake of the flu vaccine?
I hope not, Pam, because again they are two different. They're two different programs in regards to what they actually are. But you rightly indicate, as of last year, those who are now eligible for the flu vaccination has been extended greatly. From our school children through your health and social care workers, through the elderly cohorts as well. So I would encourage, as I said earlier, everybody to come forward, get their COVID vaccines, get their boosters, and get their flu jabs as well. We are now working with community pharmacy, even in regards to people who can still get their first COVID jabs, as well as using them to develop in their flu vaccines as well. We had hoped, and we do plan maybe at some point to be able to do dual vaccination surgeries where people can receive both the flu and their booster as well. Slight logistical challenges to it, but something we still intend to do. But just again, reiterate, anything that we can do, or anything that people in Northern Ireland can do to make this job easier, I would ask them to do it as well. In regards to the vaccine or the anti-vaxxers in that campaign, I think we've seen some of the outworkings of that where it has actually been dangerous and detrimental to life. Where and there's news reports today of I know not in this jurisdiction but across the border, where a gentleman was unfortunately removed from hospital support and provision by a group, and that individual has now sadly passed away. So while people are entitled to have their beliefs in regards to that, I think when they start to put those beliefs into practice where they're actually endangering others, putting our health service on is, it's unforgivable in regards to doing that.
I couldn't disagree with you at all on that, Minister. It's horrific. Actually, I did see that reported in the news. Minister, in terms of the vaccination rollout, whether it's flu or COVID, and I understand that community pharmacy now is really leading the way, I suppose, going into the winter months in terms of locality, and I think they are a great asset to us, community pharmacy. I'm just curious to know, are you going to run a bigger campaign around the accessibility of those vaccinations? Local pharmacists, are you going to put an extra effort into actually promoting this so that people are made very aware that they can actually get a vaccine close to home? Because it does appear to me to be still quite a demand for people not to have to travel. They maybe don't have the means to travel, or haven't had to travel to the mass vaccination centres, for example. So I think this is a fantastic asset to have the community pharmacy who are on most of our doorsteps, very close by. So I think we do need a much bigger campaign to raise awareness and let people know that is there and available.
Yeah, no, and look, we'll be working with PHA and again with community pharmacy. There will be over, the last figures I saw, there was over 100 community pharmacies have actually going to take up the opportunity to deliver the Moderna COVID vaccine, and that will continue an ongoing initial COVID vaccine opportunity. So even if anybody hasn't taken it up until now, there still will be those opportunities on a rolling basis. But again, the pack size, opening a vial for, it's still a multiple dose vial. So it does take, again, a bit of logistics and a bit of coordination before community pharmacies are doing that. But again, like last year, there was a big push on the flu vaccines. When we got up and running them with COVID vaccines as well, we did that. But it is, rightly as you say, it's about making vaccines as accessible to people on their doorstep as we can, and we've went through all the stages, and you've indicated them, from our mass vaccine centres, from our walk-in clinics, from our pop-up clinics, from pop-ups at Balmoral all pop-ups at universities, further education colleges. We're now into a situation where we're going through low vaccine uptake by local district area, down to postcode area. And what we're seeing is in some areas of high deprivation, there's a lower vaccine uptake. So that's where we're now, and Public Health Agency engaging with our vaccine teams and our trusts, are now going in and setting up pop-up clinics in those areas. So where people can't avail of travel or haven't been able to get to the mass vaccine centres, as you've indicated, we're taking the vaccine as close to them as we possibly can. Okay. And it is about meeting and getting it to people where they are. We're also running, you may be aware, there's a farm families, like a wee camper van, or not a camper van, it's a proper mobile setup where they actually go around the farmers markets and do blood pressure checkups, mental well-being, health and well-being. We've now partnered with them.
Minister, I'll need to move you on there because we really have other members needing in. If you could send us through that information.
Just to finish that point, Chair, if I can, the farm families, and just for one example, they took their mobile outreach to Ballymena Market a couple of Fridays ago and were able to vaccinate over 160 at it. Okay. So it is about really reaching into the rural community as well. So ask those people, and it's about the opportunity to get the vaccine when you can.
Okay.
Apologies, Chair.
Thank you, Minister.
Thank you.
Yep, thank
Sorry,
you.
Chair, can I ask one brief?
Pam, no, I'll come back to you if you get a chance, but I'll have to move on. I'll come back to you if you get a chance towards the end. Jerry.
Thanks, Chair. Thanks, Minister. Minister, I'd like to firstly ask about the health pay offer, 3% for workers. I think it's wholly inadequate. It falls way short of what workers deserve and what they're demanding and the unions are demanding. Unison will be outside Parliament buildings today as part of their campaign, and I hope you're able to meet them and talk to them directly. And much has been made of winter pressures by the Chair of the Committee and yourself, obviously, and demands placed on staff. And at a time when we should be standing with them and we need them, I think the executive with this pay offer is absolutely failing our health workers. Obviously, there's the universal credit uplift being abolished, national insurance increase, inflation shooting up, health, gas and electricity raises shooting up as well. So, Minister, I'd like to ask you, do you think our health workers are worth more than the 3%?
Thanks, Jerry. I think our health workers are worth their weight in gold, to be honest with you. I've seen them at the front line so many times over the past 18 months and even pre-pandemic. The value, I think they were undervalued, and I think there's no doubt in regards to that. In regards to the 3%, I need to be specific. That was the recommendation of the independent review body that we work from and we take our recommendations from. And that's where we're at. I have, and you'll be aware of this because I've said it before, I've 2% currently in my current budget. I need additional monies from the executive and from, I've been told to seek it, I will be seeking it in the October monitoring round to get me to 3%. Before I can make that, anything over and above that will be an executive decision as well, but it would be also out with the recommendation of the independent review body. And that was why that body was established and where they come forward with the recommendations. Again, aware of the work and the campaigns of the trade unions and what they're doing and the engagement they're having. Again, it's a body I meet regularly with, both as a collective and individually, because I value the work that our trade unions do in recognising and supporting our workforce.
Thanks, Minister. And I think I've been speaking to health workers, hundreds of them over the last couple of weeks. And every single one of them are absolutely livid about this offer, and people are used to kind of nice words from you and others about being worth their weight in gold, and that's all true. But if there isn't an offer that meets it, then people will think those words are frankly hollow. And at a time when we need to keep staff because of all the winter pressures and everything else, I think that pay offer needs to be seriously looked at. And if we're not going to pay them properly in the middle or towards the end of a pandemic, whatever situation we're in, then I would question when that is ever going to happen. But I want to move on to another item, Minister. You may have seen, obviously, the Spotlight programme on Tuesday night about further revelations about Dr. Watt and the inquiry and the review. I just wanted to ask, Minister, if you have any comment or any assessment of some of the disturbing information in that.
I haven't had the opportunity today to view the programme in full. I have had some readout of it from officials, and while I fully acknowledge the understanding and the continued hurt and the anguish and that has been around. I think all the circumstances of the neurology recall. But there's as you're aware, there are a number of independent processes that have been put in place. That includes the independent inquiry that has the power of a full public inquiry, and it also includes, I'm aware now, it was even reported in media this morning, there's a GMC inquiry going on as well. So both are independent and quite rightly independent of me. So I think, Jerry, it'd be unwise to comment on them further. But obviously, I have engaged with patients. I very much share, again, the wishes of those patients to get the answers to their questions. And I hope that the independent processes that are in place will actually help provide those answers and also the reassurances.
Okay, thanks, Minister. And some of the patients I've been speaking to, their faith in the inquiry, frankly, has been rocked by the revelations. Many of them are feeling disillusioned. So I would just ask you what you can do to restore trust and to meet them further on that. And also connected in the programme, the department referenced resource implications in regards to the review and the few people that have been their cases being fully looked at. There's concern there that this will be, many of the patients, the many thousands left, will not have their case looked at, or it'll be some time before that's processed. So, any comment on those points, Minister?
In regards to the work that still has been undertaken by the Belfast Trust and the support of those neurology patients, Jerry, I've met the team that were actually part of the review process and the staff that's doing it. Now a very dedicated, committed team to support the patients who were let down and who do need that additional support. So they want to help, they're there to help as well. Again, but the additional pressures, and it is not, and don't take it as not an excuse, but the additional pressures the COVID has put on us over the last 18 months have stretched all our resources across the health and social care system. So it's not about any intentional detraction from the importance of either that work or the support those patients continue to need.
Okay, just finally, Minister, I submitted a question last year about any work that is being done by your department around private healthcare, about taking those facilities into public ownership throughout the pandemic, and there was no sort of detailed answer back. So if there's any further work on that, or to put that on your radar, I think that would be useful with all the talk about winter pressures going ahead. Thank you.
And Jerry, I think again about taking those premises into the health services is not something I think we've said we've either the power or the legal power actually to do. But what we are doing is working with them in partnership and actually buying procedures and support for patients off them and using them to supplement where we can the work that is ongoing within the health service. So it is about that partnership approach. You'll be aware from the elective care strategy that I published that my intention is to build our health service up to a point where it sustains the work that it needs to do on its own. But at this point in time, we do not have that capacity yet.
Thank you, Jerry. And before I go to Carol, just to indicate to everyone that the Chief Medical Officer, Megan McBride, has joined us now. We're not seeing him there, but I think we're seeing you there now. So just to indicate that the Chief Medical Officer has now joined the meeting, and I'll go to Carol. Go ahead, Carol Liddell.
Thank you, Chair, and thank you, Minister, for the Chief Medical Officer for coming to the committee this morning. Before we had your presence, Minister, at the committee, our health committee agreed to invite the Brett Lockhart to the committee because the allegations that were raised in the Spotlight programme are unfortunately reminiscent of the hyponatremia O'Hara, and certainly in relation to a duty of candour and indeed public trust and public confidence. So, Minister, I don't know if you've watched the programme. I don't know if your officials watched the programme or heard what you said to Jerry in response to that intervening. But one thing I can ask you to do is provide examples of ways in which people will have public confidence and public trust in this process. So that's my first question. You did mention a lot about pressures, and I think it's widely accepted that those pressures were there well before COVID, but certainly have been persistent and overwhelming from COVID. Have you considered or discussed with colleagues or even with your officials right across the island about activating the North-South Critical Care MOU, given that we are seeing winter pressures in the summer? And my last question, Chair, is in relation to the payments to staff, the £500 payment, and you did give that at the start. But one thing I want to ask you to consider, and if you could even bring back details to the committee, when contracts are being given to independent healthcare providers, and you did make a point of saying you want to ensure that the payment goes to the employee, and I welcome that. But we do need to have some sort of clauses in that contract to ensure that those people are given the same rights and entitlements as those within our health and social care system. So just wanting to ask what levels of assurance and oversight that you will be asking. And then finally, in relation to the pay and indeed the terms and conditions, you made a decision at the start not to progress safe staff legislation. And it's been well covered that certainly the overwhelming pressures on our health and social care staff are well documented. But we have all been talking to health and social care staff, and without alarming anyone, I think we're at a stage where there are concerns around the ability to provide care or safe care, given the levels and the depletion of staff within health and social care. So what additional measures are you putting in to support the staff that are there, and hopefully staff that will be coming on board in absence of recruitment and indeed the retention of our health and social care staff? So I appreciate there was a lot in that, but I just wanted to ask those questions to give you an opportunity to respond. Thank you.
Thanks, Carl. And looking back to the first point, and again, that I suppose the biggest challenge that I have, and I've said it a number of times, is about restoring that faith and confidence in our health system, and that's why I've now launched three independent inquiries: Muckamore, neurology, and neurology. I shifted neurology into to make it a full public inquiry where it has the powers of that independent inquiry under legislation as well. I'm not sure, I wasn't aware you'd have invited Mr. Lockhart to speak to the committee in regards to the concerns that are there. I think he has before in regards to that as well, because these processes are independent and they're set up to be as well. And I know you didn't ask about it, but in regards to the Muckamore inquiry as well, in regards to the terms of reference that has just been published, the panel that's been appointed, it's vital for me, Carl, that the people in Northern Ireland have the confidence in our health service and our health workers. I think it's vital and crucial for all of us. It's also vital and crucial, and I feel it's as part of the people working in the health service, from our doctors, from our nurses, the whole way through, want to be assured that the people have the confidence in them as well. In regards to what work can be done, I'll continue to make statements, I'll continue to make people, but hopefully that when the work of the other inquiries start, that we can have that reassurance from people who are involved in it. In regards to the pressures, in regards to the critical care memorandum of understanding, we signed one last year. We have one in place. So, and that was done at a clinical operational level. You'll know me well enough, not political, Carl. It's about making sure we get support from patients from either side of the border when they need it, because at that point in time, we were coming down out of a wave just as the South was going into one. So it was when clinicians were talking to clinicians, and that was an ask that they made that we actually undertook to put that in place as well. In regards to the £500, and again, it's the contracts and the detail of that contract that we actually have that we're looking those reassurances with a multitude of employers to make sure that anything that we pay actually goes into them as well. So there's a large piece of work that has to be undertaken, and again, going back to even our social care workforce in regards to making sure that when there's tendering processes, when there's work actually being bought from different suppliers, that it's been done not just to the standard, but the employees are being supported as well. So there's a piece of work. I established a social care workforce forum, and that's going to be chaired by our chief social worker as well. And then you've met Sean Holland, his passion and his support for that workforce as well. So it's something I wanted to do, Carl, before COVID. When I come into this office, it was a direction of travel that I wanted to take, and that work has been ongoing, not at the speed that I would have liked it to, but it is still there, and that commitment's there as well. In regards to safe staffing legislation, it is again something that I want to see done. The time frame was against it. It's not that I didn't bring it forward, it's just the engagement that it actually taken to bring forward an appropriate piece of legislation that is rushed. So I felt it shouldn't be rushed because we'll get one chance at this. So we needed to get the policy developed, we needed to get it consulted upon, finalised, and again through the executive. There is again a working group established within my department. That comprises, again, as you'd expect, officials from the department, but also representatives from the trade unions, and that includes RCA, and that's been established, and it has met to consider the next steps. The working group, they've met already. They're meeting again on the 5th of October, and at that point is to scope the format of safe staffing, whether it's primary or secondary legislation, because there's a difference in what there is in Scotland and Wales. And also the scale of the legislation hasn't been fully established. So it's, before we can see the scale of what's required, it's hard to see, well, not hard to see, but the time scale of introduction can't be, we can't get that established until we see what it is. So this is about a piece of work, and again, legislation that has to be done in partnership with our trade union side, because there's a commitment that the executive made back in January 2020, when we brought our healthcare workers off the strike line. The safe staffing legislation has to be part of it, but it has to be right and it has to be appropriate.
Okay.
Chair, can I just ask one clarification?
Brief comment, Carol, brief comment.
And it will be brief. It's just to put on the record, Minister, that when we're asking questions about a duty of candour and public trust, we all appreciate that other staff feel that there might be a slight given some of the scandals that have happened, and we appreciate that you're all trying to fix this situation. But given the allegations that have been made, Minister, I would really appeal, where appropriate, to try and bring additional assurance, because there is, between Muckamore, care home scandals, neurology, urology, hyponatremia, there is a head of steam building up here, and we need to maintain public confidence in our trusts. So I just want to make that final point.
No, and I appreciate, Carl. And look, three public inquiries that I've launched. I don't think you'll find another minister across either this executive in his time since it was informed that has launched three public inquiries in that space of time, because it is about ensuring that trust within our community as well with our health service. But I think, and I value your point, Carl, and I thank you for making it, that it's not about the wider scale people and number of people working in our health and social care sector as well, but it's to ensure that the trust is there in them.
Thank you. Okay, and moving then to Paula. Go ahead, Paula, please.
Thank you, Chair, and thank you, Minister, and Chief Medical Officer for attending. My first question actually came to me first thing this morning, so I haven't had a chance really to look into it in depth, but it came from a lady who's actually a vegan, and she has said that she's chosen not to get vaccinated for ethical as opposed to medical reasons because she believes that the vaccines are tested on animals. Can you confirm or deny that today? And I suppose her concern really emanated from the fact then that if the domestic vaccine certification is introduced, then she may be excluded from premises. So could you shed some light on that first issue, please? Thanks.
Thanks, Paul. I'm afraid I'm going to have to go. I'm glad the Chief Medical Officer has joined us at this point because it's not an issue or a question I've even had raised before. So, Michael?
No, it's not an issue that's raised. Thank question. Obviously, there's extensive research carried out in the development of vaccines by the pharmaceutical companies. I obviously am not across all of the detail of that. I can certainly make those inquiries and can respond to you in writing if that's helpful.
Thank you. I would really appreciate that, Chief Medical Officer. The second question then links into that, Minister, and it's in relation to the talk of a new app potentially having to be developed for domestic vaccine certification. And I'm just wondering, is your department exploring how you could build upon the existing travel certification app?
Thanks, Paul. We're looking at what technologies we've already used for that and how they could be either amended or utilised. The challenge that we actually do is our travel app carries a level of data that we had to work with our information commissioner to get clarity for. So there's a level of data that's actually included in that wouldn't be appropriate to be in a domestic certificate as well. So it is about one not being a direct read across, but there are, Dan West, I don't know if the committee's had him recently, but when you talk to Dan in regards to the development of apps, the level of engagement that's necessary through information commissioner, GDPR in regards to what is actually necessary and what's then publicly available, there's a different level. So it's about what can be. It's what we can use not just from or the learnings we can use from our international app, but also from those other jurisdictions who have developed one.
Okay, thank you. I think maybe as a committee we would be asking Dan West to come forward shortly. I'm moving on now to long COVID, Minister, and I'm just wondering, have you got any sort of up-to-date figures on how many people are living with it? And if not, are you going to start collecting that? And also, you announced before the summer there that the long COVID treatment service will be running by the end of October. Can you give an update on progress on that, please?
Again, Paul, I know it's something that you've been pushing on from early on in regards to that support for long COVID sufferers, and we were looking to the establishment of NICE guidance in regards to the definitions of what long COVID was, where it crossed over into chronic fatigue as well. So the Health and Social Care Board are assuring me that we should have something in place across all trusts by the end of October to make sure that there is accessibility for that, but to make sure as well that we have the practitioners in place to support those patients who are coming forward. And it's at that indication I know when we start to put a framework around what long COVID as a condition actually is, that we can start to get an accurate picture of numbers. I know there are estimates being made, but I don't have them with me just in front of me, but I can get you a written update to that.
I have those.
Michael, your sound is Michael. Sorry to interrupt. Your sound is quite bad there. It seemed to come a bit better as you spoke the last time, but I don't know if you can move closer to the mic or increase volume. But just be aware of that your sound is quite patchy at present.
I should speak more loudly if that's helpful. Yeah. Okay. Just to refer, Minister, helpful if the ONS survey estimated that somewhere in the region of 975,000, so almost a million people across the UK were living with post-COVID syndrome, otherwise known as long COVID, and it was estimated, and again, as Minister said, an estimate, approximately 19,000 people living in Northern Ireland. But again, those are estimates only at this time.
Thank you. Minister, the last time you were here, I asked you about the scoliosis assessment and treatment, and you responded that the elective care framework would be looking at this and that your departmental officials were working with consultants on what you called potentially a mega clinic for assessment. I'm just wondering, could you give us an update on that, please?
Again, thanks, Paul. I'm not sure. I don't have specific details on the scoliosis mega clinic, but I do know that the number of mega clinics that we've actually run since we last met have seen roughly 800 new patients and 480 review patients. So they are up and running. I don't have the detail, but I can get again the breakdown of that to you in writing, and when the scoliosis one, if it hasn't taken place and isn't part of those numbers, when it actually is planned to be delivered as well. Again, it won't maybe see all patients that are waiting, but it will see some as we try to work through, the smaller numbers of what we're working on.
They're very encouraging figures, Minister, and I thank you for them. I wonder if you are writing to the committee, can you also provide information and figures in relation to any surgery or treatment? Review meetings are one thing, but the actual surgery is another. I think it was highlighted in the news this week about people still going to GoFundMe pages to go to parts of Europe to get the treatment. So it's a major concern for constituents of mine. Finally, Minister, and this is probably a wider piece of string type question, but it's in relation to the winter pressures on the trusts, and what you would say would be the probability of a circuit breaker this winter, and if you feel that the possibility is high, whether or not your department is starting to make preparations for it. Thank you.
Thanks, Paula, and it definitely has a wide string one there, and sort of maybe a crystal ball one too, which I hope we don't have to use. But it goes back to those earlier points about vaccination, both COVID and flu and boosters. Will all play a part. Our trusts currently, as you're aware, you've been a member of this committee for quite some time. Our trusts are putting their winter surge plans in place. They're also putting, rather than solely winter surge plans, they're also putting COVID surge plans in place. And what I've asked them to do then is that we bring those all together as a service-wide winter and surge plan, so that there is no difference in trust, that we're looking at this as a single system approach as we approach what could be a challenging 3 to 4 months, that make sure that we have the ability to look at this as a region. In regards to circuit breakers, the introduction of further steps, I hope we don't have to. But look, as I said earlier, I know the executive is looking to its meeting next week on Thursday to see what, I think Westminster talked about a plan A or a plan B. So I think the executive is doing that piece of scoping work as well, to make sure that should we have to take an intervention, that we are prepared to do it as well. What level? I hope it's as low as possible of an intervention. I hope we don't have to. But again, I get back to vaccinations, face coverings, and good hand, and the hygiene, all the rest of it, all makes a difference.
Okay, thank you, Minister. Thank you, Chair.
Thank you, Paula. And going then to Jonathan. Go ahead, Jonathan, please.
Thank you, Chair. Thank you, Minister and Chief Medical Officer. Firstly, can I start by tentatively welcoming the steps to address the winter pressures in relation to elective surgery hubs that has been announced, and I congratulate the Royal College of Surgeons who have actually pioneered and championed that for some time. But can I ask the Minister, I suppose, to give for a wee bit more flesh on the bones in relation to the elective surgery hubs, not least in relation to their location, but promoting fair and equal access for all parts of the province and also sustainable staffing. So with that in mind, where will the elective care hubs or elective COVID light hub sites be situated, and how did the department decide on these locations?
Thanks, Jonathan. In regards to the cases, I indicated a couple of points. We were looking at Oma, and also, off the top of my head, I can't remember whether it was Daisy Hill or Down as well, but it is sites that we don't currently have a large number or utilising those beds for COVID patients as well. It's about making sure that the people of Northern Ireland have access to surgeries rather than specific local sites. We've seen the development, we've actually seen the progress we've been able to make in Lagan Valley in regards to it being designated as a day procedure unit, in regards to how we can continue to manage and secure it as COVID light site as well. So it's about actually how we roll that out across. Our RPOG, our Regional Programme Organisation Group, which is now looking at surgical priorities across the region, that brings together all trusts. It brings together representatives from more medical professions as well, as you've indicated, includes the Royal College of Surgeons, so that they're looking at that as an operational decision to take, where we can actually utilise sites, what procedures we can develop there, and how we can make best use of theatre capacity. In regards to staffing, and again, you'll be aware that has been a challenge. I put out a workforce appeal recently in regards to specifically being able to support procedures in those COVID light sites. That's progressing well, and we have had a large number of expressions of interest which are now being progressed through the different levels from accreditation, so we can actually use that workforce as well as not having, I suppose, additional challenges on our own current core workforce.
Okay, and which surgical areas will be prioritised, and will arrangements for red flag surgery remain the same?
Our red flag and our priority 2 surgeries are being looked by that reasonable programme on board. That's what they do on a weekly basis. So they can identify patients across all specialities that do need those red flags and urgent surgeries. And they may have, we've said this in the past, the surgeon and the patient may have to go out of their trust area to receive it, but it's how we're taking that regional approach now. And as we move to the COVID light sites, it's also the work that they're looking at it as well. I haven't any indication just to hand in regards to what procedures they will be looking at, but I'll get you an update as soon as that comes back from the programme on board.
Okay, thank you. Minister, moving on to the debate surrounding continuing healthcare. Now, I know this policy predates the Minister, but I would be interested, I know the Minister will be, to perhaps clarify some of the revelations that many residents have come now to realise that they were entitled to an assessment for continuing care and were not aware of this, let alone afforded such assessment. It is extremely alarming. So how would the Minister respond to the allegation that changes to the continuing healthcare policy has effectively taken the rug from under the feet of vulnerable patients and residents? And I know this is something that has been highlighted by the likes of AGNI and indeed Marie Curie.
And I thank the member for his comments, and I know he's raised this a number of times, and I thank him for acknowledging too that it is predates my tenure in this office, and it was actually the piece of work that I undertook to try to tidy it up that has actually flagged it as a policy that has been about since the 70s. So it's neither new nor novel in regards to continuing healthcare. And when he mentions the comments made by NHI on Marie Curie, it was actually in 2014 that AGNI first published a report. I think, if I remember right, it's called the Denial of NHS Continuing Healthcare in Northern Ireland, and that made the same criticisms that are actually being made now. So the level isn't new. So 2017, there was a public consultation on the future of continuing healthcare in Northern Ireland, and that was about how we could bring about a transparent and fair system at that point. So when I produced the outworkings of that consultation recently, I think what has brought it to light. So there's continuing work in regards to see where that actually goes and where it finishes up. And my intention would actually be to bring on our consultation that will be launched later this year in regards to the reform of adult social care in Northern Ireland. Because of, I think, the discussion that has been now taken around continuing healthcare, I've asked that it be included in that as well.
Okay, going back to you there, Jonathan. Are you still online? Yes, go ahead, Jonathan.
Yeah, right, Chair, and I got kicked out of the meeting midway through that, so I think I got most of what Mr. said. But look, and I appreciate that this is a matter that's being looked into, and I have some written questions that are outstanding in this surrounding the background, and I'd appreciate that those will be forthcoming. But you maybe did clarify this, Minister, but an important point, was there an unwritten or informal policy that such assessments were to be discouraged, given the resource implications? And again, I think the Minister has mentioned that this will be part of an overall reform of adult social care, but will the Minister commission an independent review of this particular policy? It was implemented for a period of time.
Sorry, Johnny, there's quite an echo coming back there from somewhere. I was picking up some of that. In regards to, I suppose, the greater consultation in regards to the reform of adult and social care, there is a commitment that this is part of it. As for, I suppose, the insinuation or allegation that there was an unwritten rule, not that I'm aware of, it definitely didn't come from me in my office anyway, in regards to any sort of communication to what was actually out there. And I think the level of public interest and also departmental interest there is in this now, that there will be a look back to see what was actually done and what was being undertaken. I'm aware there may also be legal proceedings associated to it as well, which I don't want to comment on, as you'll understand.
Okay, and thanks. And just finally, as more for comment, Minister, and it's in relation to the increasing conversation now surrounding vaccination and indeed COVID passports. Can I just say, Minister, as someone that is double vaccinated and someone that has encouraged people to do likewise, I just want to commend the vaccination programme, because I know that the attention is now shifted off how successful it has been. And I want to commend the staff that have been involved in that programme and continue to reach people that otherwise have been difficult to reach naturally, never mind when we're trying to deal with something so important as COVID-19. But I do want to urge caution and moderation surrounding the language used in relation to COVID vaccine passports and mandatory vaccination. It's not something that sits comfortable with me. I think there's legal and human rights compliance issues in relation to them. Also feel that it maybe has the real risk of elevating the anti-vaccination message by pushing towards an area of mandatory vaccination. And I just want to urge that caution. And indeed, I would rather encourage a more proactive campaign right across, whether it's news stations or indeed the Assembly, to promote the uptake of vaccination as opposed to moving towards a mandatory system, which in effect could potentially do more harm than good. Thank you.
No, I appreciate your comments, Johnny, because I think that is I think that's the level of mature debate that needs to be held around this, rather than, I suppose, media commentary in regards to one position or the other, which can often get taken out of context. Our aim is to get as many people vaccinated as possible. We've always been pushing that promotion, and again, thank you for acknowledging the work that has been undertaken by a large workforce, large logistical scale. You know, if sitting here this time last year, if you would have told me that we'd have deployed over maybe 2.5 million COVID vaccines in Northern Ireland, I don't think, even as confident as I am in our health service, I don't think I would have seen it as a reality. But when I see it and how it stepped up, and how, and all credit to her, Patricia Donnelly has led this, not just from the fore, but also from the background as well, like as a testimony to the people that we have working in our health and social care system. And the volunteers that come forward, to support our health workers as well.
Yeah. Thank you, Minister. Going then to Cara Hunter. Go ahead, Cara, please.
Thank you, Chair, and thank you to the Minister and Dr McBride for being here this morning. I really appreciate your time. Minister, I recently submitted a question to the Department of Health on waiting lists for individuals waiting on a dementia diagnosis appointment. And it's quite stark to hear that over 1,834 people are currently waiting over 9 weeks for their initial appointment. I have no doubt the COVID crisis has contributed to this. However, can you please outline any steps your department are taking or working with the trusts to combat this backlog?
And again, thanks, Cara. And again, I do know something that it's something that you've raised a number of times. It's something that you're passionate about isn't the right word, but that support I do acknowledge coming from yourself. If you remember, from even the publication of our mental health strategy in regards to the underinvestment in our workforce is now having that increased knock-on effect in regards not to those dementia diagnoses, but also a number of other mental health diagnoses that we are continuing to work through as well. So from what is again an additional stretched workforce, we are working through our way through those as well. I don't have, unfortunately, any further detail in front of me, but I will get back to you. I know you've a number of written questions in, just in regards to what steps are being taken. But in regards to our mental health services, they are under increasing pressure, but they are continuing to do the core work that they need to do as well.
Thank you, Minister. Just in addition to that, recently I attended the community pharmacy APG that we have, and I'm aware of the massive role that they have played, not only throughout the pandemic, but now as we enter those winter months, and we anticipate significant pressures with the flu vaccination rollout, with the booster rollout. And I also note and welcome the UTI one-stop shop approach that they're bringing in, that they're piloting in community pharmacy to take extra pressures off GPs. But Minister, I'm just mindful with all the massive role community pharmacies are playing, what conversations have you had with them on ensuring they have ring-fenced investment and resource to carry out a number of tasks throughout the winter months?
Cara, I met with the board of community pharmacy about a fortnight ago in regards to our combined work programme that we actually have with them. We've been able to sign one off as a forward work programme. We've signed one off actually earlier this year, something that we haven't been able to do in previous years. Because as I've often said, one thing that we found through COVID is a breaking down of some of the artificial silos that we've had in the past. The relationship now, I believe, with the department has with community pharmacy is where it should be. We've worked hard together during this pandemic, and it's about a realisation of how, and I've said this in the past, that our community pharmacy are actually part of our health family, and it's about utilising the skills, the resource, and going back to the Deputy Chair's comments, the locations that they actually have cited within each of our communities, that we can utilise them to the best of their ability and the best of our resource that we can currently give them. So, I've continuing engagement with them. They're just about to change their chairs as well, but we've a good working relationship with their outgoing chair and their incoming chair in regards to what we've done as well. And also again, testimony to our Chief Pharmaceutical Officer, Cathy Harrisman, the work that she has done in bringing about that real partnership approach that we now have with community pharmacy.
Thank you, Minister. And I'm just mindful as well, they included in their discussion the importance of working towards getting proper infrastructure with IT and digital scripts. So that's something as well I think is really important to note, and that would help with those admin tasks and make the process of getting scripts a lot more seamless. Lastly, Minister,
I think there's a business case in preparation for e-pharmacy in regards to that, and that's how. Again, I spoke about Dan West earlier on. We have within the department, we have a small information technology department in regards to a lot of work that needs to be done in the digitalisation and the e-health agenda that we can progress our e-pharmacy in regards to that point, in regards to that interaction, is something that is well on the agenda and something that we want to do, because it does ease that process and also starts to removes paperwork and makes it easier for both sides of that transaction.
Fantastic. And then just lastly, Minister, recently I had a meeting with the RCN, who had voiced very strongly nurses continue to feel overlooked and they're overwhelmed also. And I'd just like to raise a concern that we had discussed, which was around Band 5, and over 60% of nurses in Northern Ireland are currently in a Band 5 position. So I know we had a discussion, I had asked a question around retention within nursing, but can I just ask, with regards to career pathways and professional development in nursing, what conversations is your department having on this matter to make nursing an appealing job within Northern Ireland? Thank you.
And again, thanks, Carl. You know, the conversations again meet regularly with my trade unions. Met with Rita recently, Rita Devlin, their new acting director. One of the things that you mentioned retention, and that's one of the things that they actually did and have done and announced it just within the last few days, was the establishment of a retention working group, so that we can actually look at that part of what we're doing to support our nurses as well. As I said in the Assembly on Tuesday, I think it was your party colleague Dolores Kelly actually raised it. What we used to do was look at recruitment and retention as a single piece of work. Now what I've asked my officials to do is actually, let's separate those two pieces of work out, because we've seen in recruitment, we've seen a high demand of people coming forward to take up those university places, even the additional university places that we've put in place. But it's also equally as important, and again, this is the conversation that I've had with trade unions, with health workers on the front line. I did a couple of recent visits to our EDs and some of our ICUs. And it's not just about workforce coming in, they need the experienced workforce there to make sure they upskill. And it's not just, I don't mean this to sound, it's not just about book learning, but it's how they actually transfer that across into practice as well. So there is a piece of work that still needs to be done and is being done, and again, been brought forward by the Chief Nursing Officer in regards to what it will be, looks at a regional retention initiative. And that's to address those immediate issues.
Thank you, Minister. And then just one quick question, just before I go. I was contacted by a young lady who had received her first vaccine in Northern Ireland and her second vaccine in England. And she had voiced that she's struggling to get vaccine digital certification. I'm just mindful, is this an issue your department is aware of? And if so, what steps are being taken to address it?
There has been an agreement on a policy by the 4 UK nations. Recently, my department, we've commenced work to update our COVID certification scheme application process that will actually enable applicants who receive either the first dose in more than one jurisdiction to evidence their COVID status for international travel. It's anticipated that we should be able to automate that full operation. Now, my note says by the end of September. I'm conscious this is the 30th. So I'll get you an update on that specific as well, because it was an issue that we have encountered and an issue that we're aware of. Not massive numbers, but if you're one of those individuals, it is something that we want to make as easy as possible. Sorry, when I say it's not massive numbers from a Northern Ireland side, but I know in Scotland, England and Wales, it was a major hurdle that they wanted to get over as well.
Thank you, Minister.
Okay, thank you, Cara. I'm going then to Orlia. Orlia, Lanneray, Cash, Lidahall.
And thanks to the Minister and the CMO for today's committee meeting. Minister, to start off, I know the last head of the committee, I had raised the issue around the MESH campaign, and you had suggested that I meet with your health officials. So that meeting has taken place in a couple of weeks' time with the Ministerial campaign group. So thanks for that. But just in advance of that, Minister, I wanted to ask if you had any update today. I know that you have mentioned that you would be making an announcement soon on the GA Cumberleach First Do No Harm report. And I'm wondering if that would be expected over the next couple of weeks before I hold that meeting with your officials. And also, since the last we met, has any consideration or conversations took place with your officials and with the department around introducing a MESH fund, the one that was introduced over in Scotland over the summer there?
Orly, I haven't had any, I suppose, representation made to me from department officials in regards to the MESH fund as of yet, but I'm still waiting on an update in regards to where we are with the full outworkings of the Dame Cumberleach report as well. Conscious that you are meeting officials in a couple of weeks' time, so I'll make sure if I don't get back to you with those details, that they are there for that meeting that you have with them.
That's brilliant, Minister. Very much. Just secondly then on the Capacity Act.
Orlia, sorry to interrupt, Orlia. Your sound is also a little bit broken there, so just be aware of that, and maybe a bit slower and a bit louder, please. Your sound's a wee bit interrupted. Thank you.
Yeah, I can hear when I'm talking. I'm not sure if everyone else is on mute, because sometimes that's the cause of it.
Yeah, could everyone just check? That's a fair point. Could everyone just check they're on mute, please? That is a likely source. So try again, Arlia. Thank you.
Okay, thank you. Yes, so just regarding the mental capacity, there has been some concerns raised with me from unions and the trusts that it's been implemented fully, but not necessarily with all the training and staffing that needs to go along. So I know that the introduction of that act is definitely a positive step forward for safeguards and for supporting those who don't have capacity. But I'd just like to ask you, Minister, what is your assessment on how are managing to implement this piece of legislation and how they're able to implement the various safeguards and processes with obviously the staff limitations and possibly the training limitations that they're working under at the moment?
No, earlier, I think, as you said, I'm aware that one of our trade unions has raised this issue. They've also taken legal advice or potential proceedings on that, so I don't want to get into too much detail, unfortunately, in regards to that. But when the Act was introduced, in regards to what it was about, was those two key offences, and that was the unlawful detention of a person who lacks capacity, and the offences by body corporate. So the offences in relation to the deprivation of liberty, they didn't commence until December 2019, when that actually came into effect, and it was agreed they would enter into force 1 year later, so it was December 2020, and that allows the Trust 1 year to implement the new statutory system properly. So it was actually an intentional postponement for the operational date to allow those trainings and information sessions to be put in place. But again, aware that there is, I suppose, a legal position being asked for at the minute in regards to that by one of the trade unions.
No, that's fair enough, Minister. I'm sure it's something we can maybe, I'm sure your department will be keeping an eye on that's progressing, and something we can come back to if need be, except the legal proceedings. Just finally then, I wanted to ask around our GP. So it's no surprise that GPs, like the overall health, is under extreme pressure at the moment. And I was just wondering if the Minister could give any commitment to opening the usual winter pressure fund any sooner and for longer, and possibly with more resources, just to allow the GPs to try and plan better what's probably a difficult winter for the whole health service.
Yeah, I know that is something that has been asked for before, and is something the Health and Social Care Board's actually considering at the minute, Leah. I haven't again had a formal readout on it, but it's something that has been asked for and something that's been looked at. So if there is any movement, I'll inform both you and the committee in regards to that decision being taken.
That's great. Thanks very much, Minister. Thank you, Chair.
Okay, thank you, Arlia and Minister, and going then finally to Alan.
Thanks, Mr. Chairman. Minister, I just want to place on record that the vast majority of the public will be very grateful for the fact that you have set up these 3 public inquiries with all that's been going on in terms of the COVID pandemic. It would have been very easy for you and your department just to kick these things the can down the road. But in terms of public confidence in our HSC system, I think it's important to recognise, and I'm sure you would agree with me, that the allegations that have been made are not reflective of the professionalism and the skills of probably 99% of those delivering our healthcare. And these inquiries, it's important that they are allowed to do their work so that they can identify important lessons to be learned going forward. The other thing that you referred to, Minister, was the issue of the anti-vaccine campaigners. I can recognise that anybody has the right to refuse to take the vaccine. They can have their own reasons for that, and I've no difficulty with that, and wouldn't argue with anybody who has deeply held views about it. But I can't understand, Minister, I'm sure it puzzles you as well, why so many people feel the need to actually actively campaign against vaccination and try and encourage other people to move to their view and not take the vaccine. And I'm receiving huge number of emails, very, very wordy, and they've been sent to every MLA, and they deploy, by about the second paragraph, they deploy Godwin's law, in which they make obscene comparisons with what's happening in Northern Ireland with Nazism and Hitler's practices, and absolutely deplorable. And Minister, in terms of the booster jobs, then I just want to ask, I've had a few inquiries from constituents. As the booster job programme is rolled out, Minister, will you be deploying the same sort of approach as the first round of vaccinations? Will it be by age groups? And can the most vulnerable in society expect to be prioritised as they were in the first round of vaccinations when it comes to the booster jobs? Thank you.
Alan, in reverse, our booster jobs will be applied for what was the first 9 criteria in our booster programme. So those with underlying health conditions or healthcare workforce, carers, and anyone over 50 as well. So it goes to that level of deployment as well. Look, in regards to the anti-vaxxers, there is a different level out there, and what concerns me is it's not just the level of opposition, but it's also now the level of threat of violence that is actually being insinuated and targeted against a number of people, both working in the health department and also the vaccination programme. So we're now seeing a different level of antagonism. And I know, and I agree with you, if people don't want to take the vaccine, they don't have to. They can voice their opinions, but when it moves into a sphere of physical threat, of violence, I think it has gone too far. These are, our vaccination programme has been managed, has been coordinated, has been delivered by people who want to save lives, who want to do the right thing. So the insinuation and the comparisons that are being made are abhorrent, and they're uncalled and they're unjust. In regards to the inquiries, I established the 3 public inquiries under that legislation, and it wasn't because I wanted to, it's because I felt it was necessary to give that reassurance to the members of the public, but also to give that confidence to the people in the workforce as well. I know you say 99%, I would say it's higher, because the number of people who don't set out to do the right thing within our health service are a very, very, very small minority as well. But we need to make sure that the people who are working in our health service also have the ability and the surety and the security to be able to highlight those practices that they're concerned about as well. So it does, and I think it also plays testimony to our health service as well. And we do this, and again, not because the department wants to. We, on an annual basis, we compile, or NISRA compiles, the annual response of complaints and compliments received across the health and social care family for the past year or so. So that has been published, and while a lot is often made of the complaints, nearly 15,000 people, 14,700 people took time out to actually make formal compliment of the service that they had received. Now, fully conscious that there are many who make complaints as well, but I think it still has a testimony, even during the past 18 months, the pressures that are on, the people are still, our general public still go out of way to acknowledge and in return those formal compliments in regards to that. And in comparison, in that statistical review for 2021, our Health and Social Care Trust received over 3,000, nearly 3,300 complaints. But when you put those two two figures side by side, I think it does show the testimony and the respect that the large majority of the people of Northern Ireland hold our healthcare professionals and the service that they continue to deliver.
Thank you.
Okay, thank you. Thank you, Alan, and thank you, Minister. There, yeah, and I suppose there is that issue around the number of inquiries that, as you say, Minister, have been found necessary, and that in itself is a concern. But it is certainly important that all of those people who are involved in those inquiries are communicated with on an ongoing basis. Just wanted to pick up one thing before I go back very, very briefly to Pam for one additional question there. A number of months ago, I think it's gone back to June now, we had asked for the minutes of the critical care modelling that was done, and that was a follow-up letter to an earlier letter that we had sent. Can you give any update today, Minister, in relation to where that's at and when we can expect to see those minutes?
Apologies, Chair. I wasn't aware that hadn't been supplied. I know we were looking at them from a redaction data protection point of view for some of the contents and names and identifiers that were currently in them. I'll ask officials to follow up on that for you. Okay,
that letter issued on the 23rd of the 6th, 21.
Okay,
Minister, so.
Yep.
Okay, so listen briefly then to Pam, please.
Thank you, Chair. Appreciate getting back in for another question. So, Minister, I wanted to ask you around, you'll be aware in the press there's been a story about an NHS worker who's been left with a tax bill of over £3,000 as a result of emergency pandemic childcare. Have you an update on where we are with that scenario, and could you tell us who has liability for any such bills? Obviously, health and social care staff really pulled out all the stops over the pandemic, and and staff being penalised in such a ridiculous fashion financially for basically pulling all the stops out and going to work in a very difficult time is really unacceptable. But has your department, or who has liability for this, and do you have any update on where we are with that and with the HMRC?
I don't have details to hand, Pam, but I am aware. I think I read the same correspondence, and I think it was an issue with Belfast Trust. I think they were a Belfast Trust employee, and I think they'd actually raised it through their trust. I'm not sure that it's come to a department level yet, but again, I'll ask officials to check with Belfast Trust just to see in regards to where that actually is.
It would be good to get an update on that, Minister. According to the article, that there has been some kind of correspondence with Department of Health and Finance in regard to a PAYE settlement agreement with MRC. So I think it would be good to get clarity around that if we could get that for
Okay.
Thank you.
Okay, well, listen, thank you for that. Thank you both for your time this morning and for addressing members' questions. And there was a significant amount of ground covered there, so I want to thank you both for that and to wish you both all the very best in the time ahead in what continues, as we are all acutely aware, to be a very difficult time out in our community and in our health and social care services in terms of the pressures on frontline workers and the extended and long-running pressure that they have been under. I think that's a key concern for all of us. So thank you for that, Minister.
Chair, thank you very much. And again, in finishing, can I thank you and the committee for their support over what is a trying period, and also your support for the messages that we've continued to put out in regards to people uptaking their vaccine, the work that has been done there, but also the support of our health and social care workforce as well. It is valued when we were able to do that, and can I thank you, Chair, and the Vice Chair. I think for what was a joint statement from the three of us in regards indicating that support for our workforce as well, because I do think it is important that we can show political unanimity in regards to that support that we have, not just from a party political point of view, but also from department and committee as well. So, Chair, thank you for that, and thank you for the continued engagement. Just in closing, Chair, I know we're going off this. Could I ask maybe someone from your side to get in contact with some of my officials to see how we can get this camera working? I know when this committee session is over and when I come off as well, so that we can get that hopefully for the next time get it working.
Yeah, we will take a look at that, and that certainly has been problematic, and it does just interfere with the quality of the engagements back and forward a little bit, I feel. So certainly that's something we need to. And I do also want to endorse the fact that the joint statement, I think that was an important message. I think staff need to know, but more importantly have the right to know, that we are all working as hard as we can and working together to address the very complex issues that face us in relation to COVID, and also predating COVID, and the pressures that were already inherent within the system, but which have been exacerbated by COVID. And there's a job of work to be done, and I think we need to ensure that we health is no place in a sense for politics. In that sense, we need to all pull together and on behalf of our community and on behalf of that health and social care workforce who have went above and beyond anything that could have ever been expected of them.
Hear, hear.
So I appreciate that, and I want to wish you all the best and take care in the time ahead. Thank you very much. Okay.
Thanks, Chair.
Okay, members, I'm going to take a short break there just to get officials back in the line for our next session. So we'll come back at 10:05 or 11:05, please. Thank you.
Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed.
Okay, thank you, members. So we're moving now in this morning's Health Committee meeting to the October monitoring, a briefing from the Department. I refer members to the papers at tab 7 of the pack, and a further briefing paper is included in your table pack, members, at tab 7.2. Also included in your table pack at 7.3 for your information is a copy of the response from the Department to queries raised during the last briefing on June monitoring. So I'd now like to welcome to committee Miss Bridget Worth, who is Director of Finance. Can you hear us okay there, Bridget?
Can you hear me okay?
Yes, I'm hearing you there, Bridget. Thank you.
Good.
And seeing you.
I'll panic there for a minute.
Thank you very much. And Miss Preeta Miller, and Preeta is Head of Financial Planning and Monitoring. Can you hear us okay, Preeta?
Yes, Chair, I can hear you fine, but can I just say there was a little mistake in the agenda, and I'm actually the Head of Capital Planning, Infrastructure and Investment.
Okay, thank you for that clarification.
Okay.
Thank you, Preeta. Thank you for that clarification, and we're hearing you there fine. We're also joined by Dr. Thomas Adele, and Dr. Adele, I think we've spoken to Dr. Adele in a different role, I think, in the past, but the title I have this morning is, or this afternoon, is Director of Transformation. Is that correct, Thomas?
That's correct, yeah, I can hear you very well, so good morning.
Thank you. And Miss Annette Palmer, and Annette is Head of the Financial Management Unit. Can you hear us okay, Annette?
Yes, Chair.
Okay, so I'd like to welcome you all to, and thank you all for your appearance here this morning at the meeting. I'll go back to yourself, Bridget, in terms of how you want to handle the opening remarks or the briefing element of it, and then I'll go to members for questions and answers. So I'll go back to yourself then, Bridget.
Okay, thank you, Chair. So I'll start by talking through the resource position, and then I'll hand over to Preeta to outline the capital position. As you've already said, Annette's here to support me for any of your financial questions, and Thomas, who is the newly appointed Director of Transformation, as you also mentioned, is here to assist on any broader queries. They'll not be making any opening remarks today.
Thank you.
The resource budget paper then starts off by outlining the current budget position post-June monitoring, together with a reminder of how we got here and the allocations we've received both for COVID in May and at June monitoring. The next section of the paper then provides a summary of the bids we're planning to submit to the Department of Finance. And I'd like to thank the clerk for some very helpful engagement the other day around the information we've provided in the paper. In particular, I understand it would be useful for you to have further detail on the bids provided in writing in advance of the session. So we did provide a revised paper with some additional information, but I will take this feedback on board more fully for our January monitoring paper. And with that in mind, I thought it would be useful, therefore, to talk you through the process we undertake in arriving at some of the larger numbers set out in the paper, particularly the trust COVID pressures of 60 million and the deficit figure of 75 million. You're all aware that the trusts each have their own finance teams who monitor and manage their financial positions in detail. They report regularly to the Health and Social Care Board on this, and the Health and Social Care Board provide a challenge function and then report a summary of the information to the department. So over the summer, the HSCB and trusts completed some intense engagement to review the trust's financial position, and it's this assessment that's fed into our monitoring position that's presented here. As I'm sure you can imagine, in the current climate, it's almost impossible to forecast expenditure with any degree of reliability, as it's unclear what level of activity will be delivered and the extent to which that activity will be impacted by COVID. Two of the key assumptions underpinning the forecasts are the amount of savings that can be delivered against the current backdrop and the extent to which a downturn in services will impact on expenditure. And these figures in particular were robustly challenged as part of the engagement process, but do remain subject to change as we work our way through the rest of the financial year. So the conclusion of that engagement process arrived at an overall figure of £80 million of COVID pressures in trusts and an underlying mainstream trust deficit position of 120 million. Centrally then, we also consider the extent to which we expect the position to change as we move through the remainder of the financial year. We know that the estimated level of expenditure provided by trusts, even after extensive challenge, tends to be higher than the outturn position, likely as a result of a combination of cost estimates on the high side and a degree of optimism bias on the level of activity that's deliverable. We also take into account the likely level of slippage on departmental and HSCB programmes that could contribute to the funding the deficit and the extent to which further funding might become available to us. For example, in particular, we've been speaking to the Department for Health and Social Care about some funding we may receive directly for lab work we've undertaken as part of UK-wide COVID programmes, and this has been factored into the COVID position, and that's what takes the bid from the 80 million I just mentioned to the 60 million you'll see in the paper. On the mainstream side, in arriving at the £75 million bid, coming down from the 120 million, we've assumed 30 million of slippage in the Trust's position. Last year, the position slipped by around 50 million on the mainstream side between October and January monitoring. That was an exceptional year, driven by some very significant downturn in activity due to COVID, and hence we've reduced the amount we're anticipating this year to what's hopefully a more reasonable level. We expect the balance then of 15 million to bring us down to that 75 to be made up through a combination of slippage elsewhere in the system and the receipt of additional income. As I said earlier, forecasting remains incredibly challenging, and we'll continue to liaise closely with finance colleagues across the system to manage the position over the remainder of the year. I'll be happy to take any questions you have on the resource position, but I'll first hand over to Preeta, who'll provide you a briefing on the capital position.
Thank you. Thank you. Okay, and we'll go across then, Preeta, to yourself. Thank you.
Yeah. Okay, thank you, Chair. Thank you, Bridget. The Department's capital budget position then post-June monitoring starts with a position of 342.4 million, which includes a specific allocation then of 12.6 million for COVID funding. At this monitoring round, our health organisations have declared capital pressures of 50.4 million and have also notified us of 43.8 million of slippage. Of this, 0.8 million relates to Northern Ireland Fire and Rescue Service in the Learning and Development flagship project, and that was due to a delay in the award of the construction contract, which should be awarded by the end of this year. But given the ring-fenced nature of flagship projects, we have to return this level of slippage to DOF. Consequently, we're left with 43.7 million towards the pressures identified by our health organisations, but there remains then a residual pressure of 6.7 million. Following the recent announcement then by the UK government of an additional 5.4 billion of NHS funding, which was allocated in England, the Minister of Finance has written to the department to advise that we'll receive Barnett consequentials of 180 million in Northern Ireland, but we don't yet have confirmation of the split between revenue and capital. The department has therefore written to DOF and bid for the additional 6.7 million of capital funding, which we were unable to fund from slippage, which we are hopeful will be met from the increased Barnett consequentials. In addition to these known pressures, you'll be aware of the volatility then in the price of materials, which is likely to impact on the cost of many of our construction projects. The Department of Finance has then also asked at this monitoring round for us to quantify any material cost increases on our capital spend. Therefore, our colleagues in CPD health projects, along with our health organisations, are currently working to establish the quantum of this pressure, but it's likely to be another few weeks before the full impact is known, and we've advised DOF of this position. In the event that we require funding over and above our existing allocation to meet this pressure, we'll then submit a further bid to DOF to cover that. And with that, Bridget, Thomas, Annette and I are happy to take any questions you have. Thank you.
Thank you, Preeta. Okay, a couple from myself first of all. So going back then to the table that we've been provided with, Bridget, and again, I want to make a general comment around the lack of detail within this briefing. I think it's really, really difficult to drill into it when it's at such a high level, and I think that does need a substantial piece of work to try to get those figures in a way that gives some further detail. So I'm going to go first of all to the issue that is in the table here for mental health and severe deprivation, 11.7 million. Well, firstly, and I know we have raised the issue with you consistently around health inequalities and what allocation of money is being put towards health inequalities, but why are mental health and severe deprivation included within the same heading there? Are they being viewed as the same thing, or why are they within the same heading rather than stripped apart?
Okay, so that's the funding we would have received between the June monitoring, and that replaces funding that we previously received from Confidence and Supply. So there were, as you say, Chair, two separate amounts, £10 million for mental health and £1.7 million for severe deprivation. They were separately received through Confidence and Supply in the past. And this figure in this table is showing the fact that we have then received that money again this year. This is part of our ongoing issue of non-recurrent funding allocations, where we've received that money in the past for a long number of years now. The services relating to that are on the ground and up and running and have been for some time, but we continue to have to seek that budget on an annual basis to ensure that the funding is there. So it's simply because the funding source is the same. We are not in any way making a judgment that those two things should be linked.
Yeah, and actually I think they should be very, very clearly demarcated and treated separately. 1.7 million for severe deprivation seems to me an extremely small allocation, but again, because we don't know what's exactly involved there, it's hard to make that judgment. In relation to the 10 million for mental health then, what is that being allocated to purchase? Is that around staffing? Is it around community and voluntary sector? What is that 10 million aimed towards, and what are the outcomes that are being hoped for or planned for by the department?
Okay, so that £10 million has been allocated, as I say, for some time. That's the £10 million for mental health that's come through the Confidence and Supply funding. I don't have briefing with me today on exactly what that's been allocated for. I know I have provided some detail on that at June monitoring, but I don't have my notes from that in front of me today. Apologies, Chair.
Okay, and that is regrettable, because our purpose today is to want to go into those figures, Bridget. So really, that's unfortunate. But I would welcome you sending those through as early as possible. Moving on to the end.
If you give me a second, Chair, actually, I've just pulled up my notes from June monitoring in my records management system here, okay. And I may be able to, I maybe come back, if you come back to me on that one, I may be able to locate that in my electronic records management system and provide that for you today, but if not, we'll certainly get back to you on it.
Okay, on NDNA transformation, the 49 million, is any of that allocated towards multidisciplinary teams? We're very conscious of the pressures that are on GPs out there. We're also very conscious on people struggling to get access to GP appointments. So is there any of that, and are we allocating funding towards the continued rollout of the multidisciplinary teams in primary care?
Okay, so 22 million of that 49 million is allocated to multidisciplinary teams. That again, that 49 million is also funding that we had received in the past non-recurrently. So at the moment, that 49 million is simply continuing the MDT provision that was previously funded under Confidence and Supply transformation funding. So that 22 million is 22 million that was already previously on the ground, but non-recurrently funded. So we have had to again ask for this money to enable us to continue that service delivery. And if you'd like me to go back to your previous point there, yes. Chair, I have in fact yes. found my briefing around that 10 million. Yes. In terms of the mental health, there are extra revenue costs relating to the Belfast Trust Acute Mental Health Inpatient Centre of £500,000. There's 1.1 billion of other underlying inescapable pressures in the mental health system that has gone towards alleviating. 3.8 million of demographic growth and inflationary pressures in mental health, and then 4.6 million to maintain psychological therapies at existing levels. As I say, Chair, unfortunately, this isn't new money. It is money that we've had non-recurrently in the past that we've continued to need to receive again to keep those services on the ground and operating.
Okay, thank you. And it would be useful to get that more granular detail around that. The final one for me then, Bridget, before I go to members, or actually I have a quick one for Prita, but the final one for you, Bridget, is around the waiting lists. How much in this current monitoring round, how much is allocated to addressing the ongoing extensive waiting lists that we're experiencing?
Okay, so we're bidding, as you can see, for £30 million of additional funding for elective care. So if we're successful in receiving that funding, that will all go towards alleviating the waiting list pressures.
And again, is that broken down into staff recruitment, into consultant time? Is there further detail that can be provided in relation to that figure?
So I think in the supplementary paper you received, you'll have seen it's broken down into 20 million to increase the level of delivery above the level in the electric care programme, and then 10 million for a specific initiative that's currently in the early stages of development around utilising capacity in independent sector facilities. And that's something we did during the very first surge back in spring of 2020. So that's the breakdown we have. I don't have a further breakdown of exactly how that 20 million would be spent. It's a combination of measures, including trying to increase capacity in our trusts if we're able to, and also purchasing additional capacity in the elective care, in the independent sector under the framework that we're currently already using. As you know, we received 30 million at June monitoring to increase our activity there, and this would be more of the same in that respect.
Okay, and is there any additional allocation then to urgent or unplanned care in terms of the Minister's recent announcement? Is that included within this, or is that being planned for now?
So the large bids that you see in terms of the Trust's COVID and the Trust deficit pressures, as part of their assessment of those pressures, they will have factored in winter pressures. It's very difficult for them actually to separate winter pressures from COVID pressures more generally, but certainly in that bid for additional funding for trusts, COVID, they will have taken into account all of the pressures they're expecting on their emergency services over the winter months. So both from COVID and from, I suppose, more routine, if that's the right way of putting it, emergency winter surges.
Okay, thank you. And just Prita, a quick one for you then around, you'd referenced there that there may be some renegotiation in terms of volatility within supply prices and things like that. And in relation to that, but also in relation to more planned contracts, do the department use social value clauses as part of your procurement in relation to capital spend?
So that is factored into the procurement process, and I know that there's been communication from the executive recently that there needs to be more emphasis on that. So it is something our Central Procurement Directorate is looking at the minute in terms of what weighting you give to social value clauses within tenders.
Okay, thank you, and I would welcome that work, because I think there is a lot of good we can do in relation to that, including addressing deprivation and health inequalities by providing a focus within our procurement across the board, but particularly given that health is a large procurer of goods and services. So thank you for that. I'm going to go to members then. At this stage I have Pam, Carol, Paula and Jerry. So go ahead, Pam.
Thank you, Chair, and thank you, Bridget and Paul, for your attendance at committee. Could I ask, first of all, why the Trust weren't able to deliver on the projected savings? Was this is it because the routine services recommenced at a faster pace than was envisaged?
So the Trusts were set savings targets in 2020-21 and it's really as a result of the pandemic that they haven't been able to give those the focus and attention that they would have needed in order to be delivered. The sorts of things that they would do around delivering savings would require engagement from a wide range of staff across the trust, and obviously at the moment those staff are hard pressed just in delivering the services that patients need. So a lot of it is the impact of the pandemic really not enabling that work to take place in the way that it usually would.
Okay, thank you for that, Bridget. And in terms of the £70 million allocated for staff pay, does that only cover the minimum recommendations from the independent review bodies, or is there scope to consider additional benefits for health and care staff?
So that 70 million simply covers the recommendations of the pay review bodies. I should say it's a bid at this stage. It's not funding that we've actually yet received. We still would need to await the outcome of October monitoring before we know whether or not that funding is going to be made available to us. But at the moment, yes, that bid, it covers the recommendations from the pay review bodies.
Okay, and in terms of additional benefits, is there any scope for?
So I suppose we would need to make an additional bid if we were to have the funding available to us for additional benefits. And I think the Minister mentioned earlier that he is accepting the recommendations of the pay review bodies, and that's why the bid is in line with those.
Okay, could I also ask then around the indicative budget for vaccine rollouts, if you could tell us what the indicative budget is for the rollout of 12 to 15-year-old vaccination, and also for booster jabs in the current financial year?
Yes, certainly. So the 12 to 15-year-old element is 3.5 million. Sorry, it's 3.5 million in total, across the two. The 12 to 15-year-old element is 1.3 million, and the booster vaccination amount of 1.8 million that we're bidding for is not the total cost of boosters. That's the extra cost that we're now expecting as a result of more accurate projections of the uptake of the booster. So at the start of the year, we received initially 25 million for the whole vaccine programme in 21-22, and we then received an additional 13 million at June monitoring to bring that up to what at that time was the full expected cost of both the main programme and an autumn booster programme, which at that time was 38 million in relation to 21-22. So this additional amount, of that 38 million, 9.2 million was estimated to be what was needed in relation to the boosters, and the additional modelling that's then been done, particularly around the high levels of uptake of the initial jab, I suppose, from the age groups that the boosters are going to be offered to, that's led us to believe that there will be a higher than previously modelled uptake, and that's why the additional funding is now being requested.
Okay, thank you for that, Bridget. 3.6 million being requested for items of equipment, including in our theatres. Could you tell us how this investment will be matched with investment in the skills needed to work in our theatres and indeed our cancer units?
I think that's probably that's falling under my remit, Bridget. So that basically is pressures that the trusts have identified where they have shortages for medical equipment for theatres and in ICU and for cancer services. I don't believe that it's that there is a skills shortage for that. So, sorry, maybe not understanding your question. I think it's more to do with shortage in equipment that needs replaced or additional equipment that's required.
Okay, that's great. Thank you. that clarifies that. And I think the last one from me for now is this £30 million for additional elective care intended to cover the new surgical hubs?
No, I don't believe that does cover the. Oh, sorry. I don't know for certain whether the funding for the new surgical hubs is included under the elective care or the trust deficit pressures, and apologies for that. But certainly the funding we're bidding for would cover the full extent of the plans that we have. But anything that we're taking forward at the moment, it would need to be covered under funding we've already secured, because this would be additional funding to increase activity over and above what's already planned.
Okay, thank you very much. Thanks, Chair.
Thank you, Pam. I'm going then to Carol. Go ahead, Carol Liddell.
Thank you, Chair. Thank you, panel. So it's just to repeat the Chair's remarks at the start. I just found it a bit difficult to try and drill down into some of the detail. First of all, I appreciate the fact that you're bidding. So there's 40 million in the budget, and you're bidding for an additional, or you have secured an additional 31.5 to tackle elective care waiting lists. But given the fact that, and it may be just put down as example rather than the total priorities, diagnostics, particularly for young people and children around autism, ADHD, even CAMS and others, hasn't been mentioned. And given that families are having to pay anything from £800 up to almost £1,200 for a private diagnosis, I just want to know where that fits in terms of any bids. And the second question I have, Chair, is in relation to these bids, the fact that it's mentioned in the papers that screening wasn't necessary, and given the fact that in your first submission on the budget, the department had several major equality concerns, why was the screening exercise not taken place? It's really, really concerning, given the fact health inequalities has always been there, but it's certainly been more persistent as a result of COVID. And my last question here is in relation to access to GPs and out-of-hours services. So it may be capital funds, Rita, I'm not sure, but are there bids to help them, dentists and other people that our constituents have consistently complained about getting appointments? So, for example, if they can't get an appointment with their GP, they're landing down the emergency department. And that seems to be a never-ending problem. So, thank you, Chair.
Thank you, Carol. Yep. Go back to yourself, Bridget, first.
Okay, so I'll pick up first on the equality question, if I may. So our comments on the equality are, I suppose they are in relation to the bids that we're making as opposed to the entire budget. So I suppose when we did the initial budget, we did that equality impact assessment, and as you rightly point out, Carol, we did identify that the total budget settlement has issues in terms of us being able to fully address equality, and some of the increases in levels of service that we would like to see will have differential impacts on various Section 75 groups. But I suppose the comment that was being made in the paper this time round was in relation to these bids, and the fact that we had looked at the extent to which those bids had equality impacts, and that we don't believe that they have any negative equality impacts. In fact, if we get the funding in these bids, we would expect them to, for example, on the elective care, we would obviously expect that to increase our capacity to deliver, and therefore to enable us to alleviate some of the inequalities that we saw in the initial underlying budget settlement. I hope that answers the question. The other question was around, I suppose, the broader waiting list issues, and I suppose that we didn't have anything put forward specifically, and you mentioned, I think, autism in particular. We didn't have anything submitted particularly in relation to that issue when we sought bids from colleagues and Health and Social Care Board, but I do know in that area that the HSCB have been liaising with trusts who have extensive waiting lists to identify how it's being resolved, and that findings are due to be reported to the Minister. And obviously at that stage, if there are financial implications or there is funding that's needed to address that can make a difference in the short term, we can look to see how that can be met. I think our big challenge in all of this is, and it touches back on some of what I was talking to in the Chair's questions earlier, we have got such a significant amount of funding given to us on a non-recurrent basis at the moment. It's really difficult for us to put anything more on the ground from in-year monitoring money, because it creates that commitment into the future that I'm just really worried isn't there and may not be available in the future budget settlement. I think at the moment, and if these bids are met, we will have around about £900 million worth of activity on the ground that's not funded on a recurrent basis, and that's obviously a massive risk to us in terms of the continuity of services going into the next financial year.
And I can probably just add a little bit just on the GP, allocations to GP schemes. So in relation to the GP improvement scheme, then since 2018-19, we've set aside £1.5 million each year for improvement to GP premises, and this is then supplemented by additional in-year allocations. And we recognise that going forward, this is particularly key then to support the schemes that are required for multidisciplinary team rollouts. So we factored this into higher allocations, and this year the allocation was 9.9 million to those schemes. Now there's been a little bit of slippage in this monitoring round, so post this monitoring round there's still just shy of 9.5 million. I think it's actually 9.4 million for the GP schemes.
Chair, can I just one final comment, please?
Carol, yeah. Go ahead.
So, Bridget, I appreciate what you're saying in terms of building expectation up. So I understand that. I think all the committee understand that. But we have a persistent inequality here when it comes to the multidisciplinary teams, recruitment and retention, particularly in relation to providing diagnostic support. So families, particularly really low-paid families, are getting themselves into debt to try and have a private diagnosis for their children, because it's going to affect and impact their future, but also their mental health. I just don't understand why that hasn't been given additional support, and it needs to be reflected in any transformation piece, because it is just an indictment on us all that this, amongst many others, has continued to happen. And my last point on the screening, see, it sounds really technical, but if someone out there is waiting, for example, on that autism diagnosis, then they're not going to appreciate the fact that an equality screening exercise wasn't conducted because they weren't featured in the bids in the first place, and I think that needs fixed. Thank you, Chair.
Thank you. Thank you, Carol. And going across to Paula, and then I have Jerry and then Alan.
Thank you, Chair. Thank you, panel, for the briefing this morning. My first question is in relation to whether an additional bid was put in for the long COVID treatment service, and if so, how much was asked for allocated?
Okay, I think we put a bid in June monitoring, or else, I believe that long COVID services for 21-22 are now funded to the extent that they need funding. I can't remember off the top of my head whether we had funding available in the opening allocation, or we may have got money, I think, in the May COVID exercise for that. But certainly it's fully funded, all of its requirements in the current financial year. I think our challenge will be ensuring that can continue next year, because again, it's another of those services that we now have on the ground with non-recurrent funding.
Well, I suppose I'm asking in the sense of the increasing information that hopefully is coming forward in terms of how many people will be wanting to avail of that service. And I suppose this is the purpose of monitoring rounds, that you are able to respond in quicker time in terms of the emerging evidence around that. So that's something I will keep an eye on. The second one is in relation to the cross-border healthcare pilot that was launched a few months ago. I'm just wondering how much has been spent on that and whether, due to demand, additional money has been requested and granted for that pilot. Thank you.
So I don't have the figures with me on exactly how much is being spent on that. I do know that the funding has been supplemented by some additional allocations from within the HSCB budget to enable that to be funded to the level that's expected to meet demand this year. I mean, again, we're looking, as we look into the future year budget exercise, to ensure that we have the funding available into the future for that.
That's everything from me, Chair. Thank you.
Thank you, Paula. And Jerry.
Thanks, Chair. Thanks, panel. In regards to the June bids, the table says there's £54 million were met. How many bids were submitted in total? And can we get a brief breakdown of them? If not today, then some other time. And if there's a gap in what has been allocated and what was submitted and required from the department.
Okay, give me 1 second, and I do have that information available somewhere. Give me a minute. So, sorry, I have my June monitoring briefing here, so if you give me a minute, I'll be able to pull that information up. Okay, so, right, so there was a £13 million bid for the COVID vaccination programme. There was £12 million for, no, wait a minute, sorry, I'm just checking, I'm not getting muddled up. I think those are my May COVID bids rather than my June monitoring bids.
Hi, Bridget, also,
yes.
I was looking as
Apologies.
well. Yeah, it's okay. I was looking as well, the bids that were put in but weren't accepted as well, if you have that.
Yes. So I think I've got, sorry, apologies for not having this maybe just as readily to hand. So in terms of the mainstream bids, then we bid for 10.7 million for EU exit related pressures, and that bid was met. We bid for £7 million to address pharmaceutical price challenges. That bid was also met. We bid for £4.5 million for issues surrounding Muckamore Abbey, and that bid was also met. We bid for £31.5 million for elective care, and that bid was also met. We bid for £1 million for cyber and information security. That bid was met, and I think the only bid that wasn't met then was £1 million for additional new ICT projects. So
that was only one that met, yeah.
There was only one bid not met for £1 million.
Okay, thanks. Two other questions.
Apologies, that took a little bit longer than you would have liked.
Two other questions. I note there's 15 million for the immigration surcharge, and as I understand it, that's the fee that health workers have to pay on top of their visa. I mean, it's very concerning from any angle that people have to pay to move anywhere around the world. But given the fact that we're faced with a massive winter pressure on our health service, has there been any view or work or consideration or recommendation from the department or the minister to call for that surcharge to be waived, to be abolished, to be suspended, whatever terminology you want to use, to ensure that health workers from across the world aren't disadvantaged and are actually encouraged to come here?
I I think there has been some work around that, but I don't have the detail with me. Just to be clear, I suppose the health surcharge is levied on most UK visa applications to fund access to the NHS. So it's not specific to health workers, and I'm sure you didn't maybe intend to suggest that it was. I know there has been some suggestion that it should be waived for health workers, but I don't have detail with me today on what exactly the detail of that is. I know not because it's my policy area, I suppose, but because we were expecting that our share of this income may drop as a result of there potentially being such a waiver, but I can't remember whether it actually happened or didn't happen.
Okay, thanks. And I mean, my understanding is that health workers are having to pay an extra cost as other workers are on top of their visa cost. But you know, I appreciate if you could share that information on that. And then just finally,
briefly, Jerry, please.
Yeah, has there been any equality screening, Bridget, around the pay offer, the 3% pay offer? I mean, inflation is obviously above that. Fuel is increasing, and has there been any consideration by the department or the minister about possible pay offers beyond the 3%? Has that been factored in any conversations?
So my understanding is that the Minister is minded to accept the recommendations of the pay review bodies in this regard, and so that's the basis on which we've calculated our bid at October monitoring.
Okay, any equality screening work done on the bid? Pay offer?
Sorry, so in terms of the bid itself, I suppose we haven't identified any negative impacts of the bid, but I don't know whether my colleagues in workforce policy have what screening has been done on this. I don't know. I'm sorry, I don't know the answer to that question. Apologies, I'm stumbling a bit.
Appreciate just so we get some information if it exists or not. Thank you.
Thank you.
Okay.
So we have a few more members have now indicated, and I have been trying to allocate time out to members as briefly as much as I could. Members have just come in, so if I can ask Alan, Ciara, Jonathan and Orlia to be very brief responses. If we need additional information sent, we can ask for that, but we do need to get this session ended at 12 to get the next session in place to get members out to that event that's taking place outside the building by Unison. Go ahead, please, Alan.
Thank you, Mr. Chairman. I will be brief. Bridget, in the Table 1, there's £350,000, I think, allocated to the Northern Ireland Protocol. Can you tell me, is this purely a contingency figure, or do you know where that might be spent and where it might be deployed? And just, has the need for the department to increase stocks of medicine and medical devices been removed by recent commentary around the protocol? Thank you.
Okay, so that £350,000 specifically has been used to fund the team of staff that we have in the department that we've needed to create in order to enable us to continue to address those EU exit issues. That there was additional funding, I think, as I've just mentioned to Jerry, of £10.7 million also allocated in June monitoring to deal with protocol issues, to deal with EU exit issues, not all of which were directly protocol related. And I think that there are ongoing issues, and the team who's in place, you'll see that bid of a further £290,000 to continue to supplement the number of staff that we have in place to deal with those protocol issues. It would be premature, I think, for me to say that they've been solved, but Cathy Harrison, our Chief Pharmacist, would be better placed to comment on the ongoing issues than I would.
Thank you, Bridget.
Thank you, Alan. And Ciara?
Thank you, Chair, and thank you, panel, for being here this morning. And one of the issues I was definitely concerned about was monies going toward the Brackenburn Clinic for gender identity services. And I'm just curious, is the department seeking any additional funding at this time. I'm just mindful they're struggling to get a psychiatrist there. So just any further information on that would be great. Thank you.
I don't have specific information on that exact issue, unfortunately, but as I say, that there is a significant bid there from trusts to deal with sort of all of their funding pressures that they're experiencing that are inescapable in the current financial year. But I don't know any specific details about that particular issue.
Okay, thank you. I'm just mindful as well, for the Bragganburn Clinic, it's taken now 3 to 5 years to secure an initial appointment. So that's unfortunate. There's no further information, but I can take that back to the department. And then just in addition to that, I kind of agree with the chair. I believe there could have been more detail in our brief. And I'm just wondering, with that 60 million going towards trust pressures, can you just outline further what that's been allocated to?
Okay, so as I said before, this is at the moment a bid, so there hasn't been any funding actually allocated yet because I suppose we haven't got our hands on the money yet. But the sorts of things we're seeing that are increasing those costs are a lot, obviously, in relation to staffing because of all the pressures in hospitals. So we're seeing costs of agency staff, costs of overtime, enhanced rates and additional shifts all increasing as more staff are needed to respond to the pandemic and as our existing staff become sick or need to self-isolate. We're also seeing increased lab costs. That's driven both by the continuing need for patient testing and also the increasing requirement from testing centres as the public have come more into contact with COVID positive individuals. And we also knew when we started the year that some areas we only had enough funding for part of the year, and we needed time to see whether it's realistic to see whether some of those measures could cease. And we know now that it's unlikely that the majority of our interventions will cease in line with those initial assumptions. So in common, I suppose, with the position across the water where we've seen that additional funding being allocated in England, we're finding that we need more funding than we'd originally projected.
Okay. Thank you, Bridget. Just in interest of other members, that's it for me. Thank you.
Thank you, Cara. And Jonathan, please.
Thank you, Chair, and thank you, officials, for your briefing thus far. I suppose my concerns are similar to that of Alan's in relation to the worrying amount of funding now going towards protocol-related pressures, something that has risen almost double. Can I ask, obviously understanding from your question or from your answer to Alan, that's regarding staff within the department. Obviously, this is a period now whenever there's grace periods, so therefore the need for a full scaled up service is not there. Could I ask, is there any indication or any discussions within the Department of Health about what would be the projected costs related that would be needed, to cover the Northern Ireland Protocol if it was fully implemented, or in terms of some members rigorously implemented?
I don't think it's possible at the moment to work out what it might cost because there's still a lot of uncertainty around what exactly it's going to look like. I don't have projections for that reason because I think we still need to get to a point where we understand what a workable protocol would bring. As you say, that I mean, without getting into the politics of it, I think that perhaps the reason that the grace periods have been extended is because there needs to be more time to work out what the solution might be.
Well, given, and I would ask, and I realise you don't have this to hand now, but I would imagine there is an element of forecasting now going on within the department as to what the costings would be. So I would appreciate, whether it's via writing or the next time you do come back to the committee, that we have a forecasted sum of what it would cost if we see the full implementation of the protocol as interpreted by the Department of Health at present.
I can certainly take that back to colleagues on the pharmaceutical side.
Thank you.
Okay, thank you. Okay, thank you, Jonathan. Bridget, is there other potential cost implications to Brexit outside of the protocol? So are there Brexit implications and protocol implications?
So I suppose at June monitoring, that 10 million of our bid at June monitoring that was successful was for general pharmaceutical price pressures that we're seeing, and whilst it's not possible, I suppose, to really know to what extent they're because of the protocol, because of Brexit, or indeed because of wider global price pressures as a result of COVID. So I suppose we had put that bid forward under the EU exit bracket, but it's not possible to distinguish whether they're Brexit costs or protocol costs, if that makes sense.
Well, that does make sense, and I think that needs to be made clear that you know. So there's three actual. There's global conditions, potentially pressures. There's Brexit and there's protocol. So we don't want to, you know, in a confusing way, put everything under the heading of protocol moving forward. If actually some of those things are related to fundamentally to Brexit or to other pressures. So I think those need to be carefully identified and communicated to the committee. Okay. Thank you. Two other wee quick ones, and I know we have our other officials. I've been talking to a lot of GPs, and I'm very conscious of the pressures that GPs are under, but also the fact that people are struggling to get appointments. One of the issues that the GPs have suggested could help to alleviate some of the pressure from their perspective is if the winter pressures payment, which is likely to be needed and has been needed consistently, if that could be brought forward. Is that something that can be looked at positively by the department to bring forward the winter pressures payment to GPs?
Okay, so as I understand it, the funding for that is available. At that point, then it's my policy colleagues then who would take forward the timing of when that funding is made available. So from my perspective, I understand the funding is there, so I can't really give you any further insight into that.
Well, I think if you could bring that back to your policy, I think that would help to alleviate some of the pressures on GP and help to facilitate more appointments for the public as well. That's what we're being told. So if it's going to happen anyway, and if happening sooner could be beneficial to everyone, I think that should be looked at positively. The other issue that I wanted to raise is, and these are both emerging, well, the phone system certainly as a result of a survey that I've been doing over the past period of time, and there continues to be high levels of concern around access to the phones through the phone systems. I know you've indicated that some money has been put in there. Are there any plans at present to put further money in to improve the phone systems? And I know you've touched on the GP improvement scheme as well, but are there any plans in place at the minute to look at the phone systems for GPs?
I'm not sure if that falls under my side, but I'm sorry, I don't know specifically about the phone system, but I do know, as I was saying earlier, that 9.4 million has been allocated to GP capital grant and loan schemes. So there is money allocated towards improvement of GP premises, but I'm not sure. I'm sorry if they're about the phone system, but I can certainly take that question back to policy colleagues as well.
Okay, and that will be useful because that is a particular pinch point for members accessing, and it's having huge knock-on effects through the system into emergency departments and all the rest of it. So that would be possibly a useful piece of work, Brita, and I appreciate you doing that. Orlia has indicated helpfully that she will follow up in written format with the questions to facilitate us time-wise, and if any other members wish to do anything in relation to this monitoring round, if those can be forwarded to the clerk and forwarded on to the department that way, I appreciate that. So, members, thank you for that, and I want to thank the panel for coming along today, providing the briefing, and we will no doubt be seeing you again in due course. And I would reiterate that we would like to see more detail up front so that we can get into the conversation quicker rather than teasing that out. So I'd appreciate your attention to that, Bridget, if you please, over the next while. Thank you for that, and I can then so we can move on to our next panel. So thank you, Prita, Thomas, Bridget, and Annette. Okay, members, we are going then to our final briefing today, which is the briefing in relation to the Adoption and Children Bill. And where department officials are here today for the second part of the briefing on the principles of the bill ahead of the second stage. You'll recall that we did the first part of this last week, members. I refer members to the bill and the EFM at tab 8.1 to 8.2 of the pack, and to the speaking notes provided by officials at tab 8.3 of your table papers, members. So I'd now like to welcome to committee Julie Stevenson, who is head of the Adoption and Children Bill team. Can you hear me okay, Julie?
I can, yes. Good morning.
Thank you, Julie, and we can hear you there. Frances Nicholson, who is the Social Services Officer. Frances, can you hear us okay? So we didn't hear you there, Frances. You may be on mute. Just check that and I'll go through the rest of the panel. We are also joined by Liz Marsh, who is a member of the Adoption and Children Bill team. Liz, can you hear us?
Yes, I can. Thanks, Chair.
Thank you, Liz. And Pamela Mullen, who is a member of the Adoption and Children Bill team. Can you hear us okay, Pamela?
Yes, I can.
Okay, thank you very much. And I'll revert back to yourself then, Julie, in terms of if you want to outline for us how you want to do your opening remarks or presentation, and then we'll go to committee for questions. And if I could remind everyone on the meeting who's online to remain, please, and keep yourself on mute while not speaking. Thank you. Okay, Julie, go ahead.
Okay. Right, I'll give a brief overview then of the main provisions that we're going to cover today, and then we'll be happy to take any questions. So last week, committee members were briefed on the adoption provisions in the Adoption and Children Bill, and as agreed, today's further briefing is focusing on the other provisions in the bill. In addition to strengthening and consolidating the law on adoption in Northern Ireland, the bill also makes amendments to the Children Order to extend and strengthen provision with the aim of enhancing services and improving outcomes for children and families in need, looked after children and care leavers. For children and families in need, the bill will give social workers more flexibility to provide financial support, not limited to exceptional circumstances. The Department will issue statutory guidance for trusts to ensure that there is a regionally consistent approach to making such payments. Disabled children will be able to benefit from residential short break without having to become looked after. There will be guidance to help social workers decide the safest and most appropriate way of supporting each child in these circumstances. The bill also includes a power to extend this to other groups of children if required in the future. The bill will support children and young people who receive social care to raise issues or make complaints about the services they receive and have their views responded to appropriately. The complaints procedure that already applies for services provided to children and families in need, looked after children and care leavers will be extended to include specified functions under Parts 5 and 6 of the Children Order, and that is the care, supervision and protection of children, and also to adoption and special guardianship services. Statutory independent advocacy services will be available to support each child throughout this process. The bill introduces in law a set of corporate parenting principles which trusts must follow when looking after children in care and providing services to care leavers, including having and promoting high aspirations for them, delivering safety and stability for them, and preparing them for adulthood and independent living, ensuring they receive the same opportunities and life chances that any good parent would seek for their own child. This includes the same learning opportunities and outcomes. The educational outcomes of many children in care are poor when compared to their peers. The bill will require trusts to promote the educational achievement of looked after children and prevent disruption to their education and training when providing them with accommodation. By way of a power in the bill, the Department will also be able to require or impose additional measures considered necessary to address the educational deficits many of them experience. The bill will place the existing system of care planning on a statutory basis, requiring trusts to prepare a care plan for a child within a timescale set by the court and keep it under review. We will set out in regulations how the care plan is to be drawn up and the information to be included in the care plan. Fostering panels currently make decisions about whether a person should be approved to foster. The bill will enable the Department to make regulations setting out the functions of fostering panels and how they should operate. Individuals who disagree with the decision made about whether they should be approved or continue to be approved to foster will be able to ask for an independent review of the decision. This is similar to the review mechanism being introduced for adoption decisions. Trusts will be required to consider the placement of a child with duly approved carers if adoption is the proposed plan, enabling the child to be able to be placed with approved prospective adopters initially on a fostering basis. This is intended to facilitate earlier attachment and to potentially reduce the number of placements a child waiting to be adopted may experience. Duly approved carers will have access to adoption pay and leave arrangements, including shared parental leave and paid time off for attending pre-adoption appointments. Provision in the bill will enhance the support provided to care leavers as they transition into independent living or move into further or higher education. The bill will recognise in law the Going the Extra Mile scheme, which enables care leavers to continue living with their former foster parents up to age 21. Support provided to care leavers who are in education or training will be extended up to age 25 from the current age of 24. The bill also includes a the Department to amend the age limit of 25 required or request advice or support. This advice or support may continue beyond age 25 if the Trust considers that it is needed. Young people receiving such additional support, advice or assistance will have a personal advisor appointed and a pathway plan in place throughout the time that they're receiving the assistance. The bill will also place a duty on trusts to publish information on the services they offer to care leavers in preparation for adulthood and independent living, and this will be known as the local offer for care leavers. The bill will also introduce some new court orders and make adjustments to some existing court orders. Currently, a residence order stipulating with whom a child should live is granted to age 16, unless there are exceptional circumstances to extend it to age 18. The bill will provide that residence orders made in respect of a looked after child will be automatically granted or extended to age 18 unless the court determines otherwise. The bill will also amend the time a child has to have lived with a foster carer from 3 years to 1 year before the foster carer can apply for a residence order in respect of the child. This amendment will ensure consistency with the residence requirements for adoption and special guardianship orders. A special guardianship order, or SGO, is a new order being introduced in Northern Ireland, although they have been operating in England and Wales since 2005. An SGO offers an alternative option for permanence and legal certainty outside of the care system to children and young people for whom adoption is not so suitable. Unlike residence order arrangements, special guardians will have full parental responsibility for the child's day-to-day care, and unlike adoption, the legal ties between the child and their birth family will remain in place. While the bill's SGO provisions are similar to those in operation in England and Wales, we have further strengthened some of the requirements, including that the child has to have lived with the person for at least 1 year before the person can apply for an SGO. This will ensure that a proper assessment can be made of whether the arrangement is in the child's best interest and likely to work for them and their carers. Trusts will be required to prepare a court report about an applicant's suitability to be a special guardian, including any support that will be required. And it is anticipated that for looked after children, regulations will place a requirement on trusts to submit reports to a panel to ensure a robust and comprehensive assessment has been carried out prior to submitting the report to court. Under the bill, and where required, special guardians and the children they care for will be provided with support. Similar to adoption, there will be a right to request an assessment of need for SGO support services, and support will include counselling, advice and information, and financial support, and other services to be set out in regulations. The introduction of this additional order will enable some children and young people to exit the care system with relevant support and assistance continuing to be provided to them, and their special guardians. The bill also makes a number of other miscellaneous amendments to the Children Order. The definition of harm will be amended to cover harm caused to a child from seeing or hearing the ill treatment of another person. As a result, courts, police and trusts will be required to consider the effect on a child of witnessing domestic abuse when making critical decisions about their care or upbringing. The definition of family proceedings will also be amended to include proceedings for female genital mutilation protection orders, enabling a court when dealing with an application for an FGM protection order to make other orders at the same time to protect the child. These could include an interim care order, a care order, or a supervision order. The change will enable the court to act quickly and effectively to protect girls who are at risk of FGM. The guardian ad litem who represents the interests of children in specified proceedings will be renamed as the Children's Court Guardian. The Northern Ireland Guardian Ad litem Agency will in turn be known as the Children's Court Guardian Agency for Northern Ireland. The service provided will not differ, however, the proceedings in which a Children's Court Guardian will be required to be appointed will be extended to include applications for the making or revocation of an adoption placement order, orders for contact during placement for adoption, and applications for the making of a special guardianship order with respect to a child who is subject to a care order. The Children Order will also be amended to enable Children's Court Guardians to be directly employed by the agency instead of being drawn from a panel, as the current law requires. Any person who proposes to foster a child privately is currently required by law to notify the appropriate trust before the arrangement commences. However, to date, no such notifications have been received in Northern Ireland. The bill will introduce a new duty on trusts to raise public awareness of the requirement to notify the trusts of such arrangements. The Department is also currently required to produce an annual report on the operation of the Children Order. This duty will be repealed under the bill, as it has been identified that the production of this report replicates or duplicates other reporting mechanisms that are now well established. And that concludes my overview of the Children Order amendments in the bill, and we're happy to take any questions.
Okay, thank you, Julie, and that's a good quick overview on what is clearly a very complex and a very, very important bill in terms of the potential future impacts on all of this that we're discussing. My first question is around something that I don't see nor I haven't heard in your briefing today at all, and that's on the issue of kinship care. And I'm just wondering, in relation to the special guardians and in relation to what you said about the child's best interests and what's likely to work for them and their carers, is kinship care seen and represented within this bill as valuable? And in fact, even more so, I would suggest that within the sector, that it's seen as actually the next best option after, for whatever reason, that birth parents are not able to continue with care, that kinship plays a huge role. I have seen very little reference to it. I'm a wee bit concerned. So could you give me your thoughts on relation to the recognition of kinship care and how that will be supported and valued within this legislation?
Absolutely. You may be aware that we did set out possible proposals that we consulted on for actually introducing a model similar to Scotland around the introduction of kinship care orders. Although not actually a legal order, they were specifically aimed at kinship carers, informal kinship carers who were looking after children sort of at the edge of care, who were at risk of coming into care. And it was very much linked to a requirement for the kinship carer to also obtain a residence order and then access relevant supports. When we looked into it further, we felt that this was not going to work in the Northern Ireland context, and we're not proposing to go ahead with that. But there are a range of provisions in the bill that will assist informal kinship carers to continue to support children on the edge of care. The main one of those is
sorry to interrupt, Julie. Why does it not work within the context here? And are you saying that does the potential remain within the bill for kinship carers to become the adoptive, foster and potentially adoptive parents? But more specifically, why does it not work within the context of here in the north?
Okay, well, certainly what the one thing that we realised with Scotland don't have special guardianship orders in place, and we do expect that that by introducing special guardianship orders here through the private law order, that informal kinship carers will be able to access those orders and as a result receive an assessment of need and receive services from the trust in those scenarios. Also, the other aspect that we feel will be of particular benefit to informal carers will be also the extension of the Article 18 cash payments. By reducing the wording of exceptional circumstances, we're broadening the scope for those payments to children and families in need, which would in particular include informal kinship carers. We also have plans to produce guidance to set out for trusts approach as to how informal carers should be supported. And that will link in very much with the draft family and the family and parenting support strategy, which the department is currently in the process of preparing to bring forward.
Okay, Julie, I hear an awful lot of reference to informal care there. I'm asking about kinship care being part of the formal care proceedings within this bill. That kinship carers would were they are in the child's best interest, that kinship carers would be recognised in terms of the formal processes within the bill.
Absolutely. Well, informal kinship carers can, as part of the current arrangements under the Children Order, a trust is required when considering where to place a child to consider a placement initially with family. So priority is given where possible to placing a child with their kinship relatives. And it's only where those types of placements aren't appropriate that they then would move to look to place a child with an authority foster carer who is not a relative. That will continue to be the position. And we will go on later to discuss also the placing of children with duly approved carers. And as part of those provisions, the Trust will also, before they move to consider placing a child with a duly approved carer, that's a carer that's approved for the purposes of where the child's plan is possibly adoption, to place carers at the earliest, placing with carers who are duly approved as foster carers, to also consider, again, initially, the placement of the child with relatives.
Okay.
If Frances may be able to add to that, I'll maybe ask Frances to maybe come in on that to see if she can give a bit more clarity around that.
Well, actually, if you could send us on that information, because I'm conscious about other members needing in. I am glad and I welcome the fact that kinship carers are there. It brings me back to the point I raised last week and I'd asked for further information on, in relation to where, in our situation here on this island, where kinship carers could often and do often potentially live on the other side of the border. And that could be on the same road as the child's own home, it could be on the same farm. But we were told here last week that those would be treated as inter-country adoptions, which have additional hurdles. Now, I have asked for information as to how we currently interact with the 26 counties in terms of these proceedings, and also what the additional hurdles are, as represented within the Hague Convention, would be. But do you have any further information in the absence of that having been sent to the committee? Do you have any further information as to how that will be managed here in our unique situation?
We are currently we're preparing a paper for you to give you an overview of all of that, and hopefully we should have that with you very soon. Okay. In relation to how the adoption.
Oh, okay, thank you, and I look forward to receiving that.
Say something more around placement of family.
Okay, thank you, Julie. And the final one for me then is a brief one, I hope, around the definition of harm. And within this legislation, you refer to definition of harm will be amended to cover harm caused to a child from seeing or hearing the ill treatment of another person. Trusts will be required to consider the effect of a child of witnessing domestic abuse. And you will be aware that the Assembly has passed a domestic abuse bill which expands that out to include where children are experiencing or living in a situation. Do you not think that it would be helpful if this bill was more in harmony with the domestic abuse bill that has recently been passed in terms of definition?
Yeah, we certainly. Yeah, we certainly considered the bill, the wording of the bill when it was going forward. At that stage, the way in which we were considering it was not considered appropriate to link in with those definitions. But what we have agreed is to the issue has certainly been raised by our stakeholders about the possibility of trying to broaden that definition of harm further to apply to encompass where the child is actually not present when abuse takes place but is living in the home and is impacted by the effect of that abuse. And we've given a commitment to consider that further, and any amendment to broaden that further would be brought forward later in the passage of the bill, possibly as part of the consideration stage.
And why was it felt not appropriate at the earlier stage?
Liz, would you be able to answer that?
Yes, Chair. This was something that that we considered during the development of the domestic abuse legislation for Northern Ireland, and we were conscious that the definition was broadened in that legislation. I would add also that England and Wales were considering also tying their definition of harm in with that broader, more up-to-date definition. But what we concluded was that we are, yes, wishing to include within the definition of harm the ill treatment, a child witnessing the ill treatment of somebody else, but the definition is broader than that, and it's intended to encompass all forms of ill treatment. So whilst we wish to, highlight that children's harm caused by domestic abuse is a factor, the broader definition of harm, and particularly as applies in case law, we were advised, maybe compromised, if we were to specifically tie it in with the definition in domestic abuse legislation. However, as Julie says, there are ways of doing that where we certainly could bring forward, prepare an amendment to link to where a child is adversely affected by domestic abuse that they haven't necessarily witnessed themselves.
Okay, thank you, Liz and Julie. So I'm going first of all to Pam, then Ciara, Paula, Jerry and Carol. In that order, that's the indications I have at present. So I'll go to the Deputy Chair there of the committee, Pam Cameron. Go ahead, Pam, please.
Thank you, Chair, and thank you to the panel. I have a couple of questions here, and the first question really has three parts to it. So is it correct that Northern Ireland has the highest level of parental contact among adopted families than anywhere else in the UK? And the second part of that is, are there concerns that adopters somehow feel under pressure to facilitate arrangements, even where they believe it's not in the child's best interest because it might impact the outcome of their application? And then the third part to that first question is, does the bill take a fresh approach to contact?
Okay.
Sorry, Julie. I think you froze.
And then
Julie, can you hear me, Julie? Your sound is quite bad there, and I think it's getting actually worse. It has been quite a little broken up as we come along. So can I check if Francis is able to come in on that answer while Julie is checking her sound?
Yes, indeed, Chair. Can you hear me okay?
Yeah, hearing you, Catherine. Thank you.
Okay. Pam, that is correct that Northern Ireland probably does have the highest level of direct contact in the UK post-adoption. It is something that has been ongoing in Northern Ireland for quite a while. There would be some feedback from some of our voluntary organisations and stakeholders that prospective adoptive parents and adoptive parents may feel under some pressure to facilitate contact
Contact should always, as we really outlined last week, should always be in the best interests of the child. And obviously after adoption, that will involve the adoptive family, in helping to determine the best interests of the child. So we're really hopeful that the 2 new orders that are to be introduced through the Adoption and Children Bill, one about contact during a placement for adoption, and one in terms of a contact or a no contact order following adoption, will help to clarify this situation, and hopefully that all parties to the adoption triangle will feel supported to negotiate those arrangements. Currently, a lot of the arrangements are undertaken on a voluntary basis, and we feel that introducing these orders on a statutory basis will really enable, clearer negotiation on these matters. And if there is a situation where it really is not in the child's, the paramountcy of the child is being, negated in some way, then obviously the court can rule that ongoing contact is not to happen and is not appropriate.
That's great. Thank you for that clarity. My second question is, how often do reviews of care leavers take place, and how will the proposed statutory duty enhance protection?
Okay, I don't have the current timescales for care leavers reviews. Maybe someone else may have that to hand. What I can say is that the care leaver reviews aren't being impacted in any way by any provision under the bill. That will continue to apply, and we're not changing that. Does anyone else have the
generally
the timescales?
Sorry, Julie, for interrupting. Generally, care leaver reviews are undertaken on a 6-monthly basis, but they can be organised as and when required. So if a significant event is happening in, a care leaver's life, etc., and a review would be helpful, they will be organised to take place to assist with determining whatever the significant event, or permitting the significant event, or helping to discuss the significant event in a care leaver's life. So to a large degree, they are organised as and when required, but also on a 6-monthly basis.
That's great. Thank you very much.
Okay, thank you, Pam. And going then to Cara. Lana, Cara.
Thank you, Chair, and I'd like to thank the panel for their briefing. I found it very informative this afternoon. I just have a question around educational achievement. Clause 122 touches on the duty of authority to promote educational achievement and prevent disruption of education and learning. And we noted in last week's briefing that children who are often adopted at a later stage in life tend to have a lot of complex behavioural needs. I know that academic achievement is extremely important in a child's life, and it contributes to their overall well-being. So can I ask just what this bill will do regarding supporting a child's academic achievement during difficult transitional periods that they may experience? Thank you.
Well, the 2 things that the bill actually does are really around while the child is in care, in relation to promoting the duty on the trust to promote the child's educational achievement, and to, wherever possible, not disrupt their education when considering accommodation for the child. Also, the corporate parenting principles that we will introduce as well highlight the need for educational achievement to be promoted for children and young people. Post-adoption, it will be a case of, as part of the whole support assessment, if there's anything particular that would need to be put in place where there are issues around the child's educational achievement post-adoption, and those would probably be discussed and agreed between the social worker and the adoptive parent.
Okay, well, that's great. I have one more question, but it was actually answered from Pam there. So thank you very much, Julie. I appreciate your answer.
Thank you, Cara. And moving then across to Paula. Go ahead, Paula, please.
Thank you, Chair, and thank you, panel. Apologies I wasn't here last week for the initial briefing, so if these have already been answered, apologies for that. The first question is in relation to same-sex couples where fertility treatment has been accessed in the Republic. At the minute, only one name is permitted on the birth certificate as the treatment didn't occur in the United Kingdom. Is that remedied through this bill?
No, not that I know. We're not doing anything around fertility treatment and surrogacy or any of that. What we will be doing is we will be working with the Department of Finance once our new legislation comes in to ensure that any aspects of the adoption provisions in the bill are modified for parental arrangements for surrogacy and the fertility aspects of it. That's currently happens with the legislation, the adoption order of 87 at the moment, and we'll work with the Department of Finance to make sure that those modifications continue to apply. But it's a policy matter for the Department of Finance, and we will work with them to make sure that it is brought forward, but we're not doing anything specific.
Okay, thank you. My next question is in relation to children who are born as a result of rape, where the father isn't on the birth certificate, and whether there's any provisions there to prevent a legal right being asserted at a later stage for access to the child, and also in relation to where the mother has now a new partner, husband, where the husband would want to legally adopt the child, but that they would have to go back to the rapist essentially and ask for permission for that to take place. Is there any provision in this bill around that scenario?
No, there isn't. Francis might be able to advise about what happens currently. All we have done in relation to step-parent adoptions is we've removed the anomaly that was in the 87 order around such scenarios where the actual parent in the step-parent situation also had to adopt because it had to be done as part of a couple, and that has now been removed. But Francis might be able to advise. Parental responsibility in those circumstances, I think, is a private law matter. Francis, would you?
Yeah, in relation to the first part of your question, basically, I'm really hopeful that the post-adoption contact situation will resolve that, in that the court can make a ruling that there should be no contact in certain situations. Obviously, that doesn't prevent somebody from applying for contact. But, the whole matter will be considered. It will be a court decision, and the court can obviously make a ruling for no contact in certain circumstances. In the second situation that you are referring to, as is the case currently, a new stepfather or a new partner can go on to adopt the child. As Julie has just said, that will not now require the mother or the parent of the child to re-adopt the child. That's one of the amendments that I consider will be highly beneficial from the legislation. And obviously the adoption agency or trust have to prepare a report for the court in those non-agency placements, and would hear from the mother if the circumstances around the conception were of a rape nature, and they would obviously take that into account and report such matters to the court, and the court will then decide whether that person's views have to be ascertained and how much, I suppose, weight would be placed on them.
Okay, thank you. I'll explore that a little bit further, obviously, during the consideration, but I just wanted to flag those up. And the third one is in relation to adopting across different religious, ethnic or cultural situations. And I'm just wondering, that may have already been addressed in the past, but it's something that's been raised recently with me in terms of, where maybe it's going from one religion or one ethnic group to the other. What provision is specifically in this bill around that?
Okay, I could probably answer that. Currently, under current legislation, when giving agreement, when a parent gives agreement to their child, parental agreement to the child being freed for adoption, they can stipulate that can be, the religious persuasion with the religious upbringing for the adoptive family. That has been removed going forward in the bill. However, as part of the overall welfare checklist that has to apply in adoption decision making, trusts will be under duty to give due regard and consideration to religious persuasion alongside racial origin and other matters. So it is still covered in the bill going forward.
Okay, sorry, very, very quickly, Chair, apologies. I was approached there about the Children and Young People Strategic Partnership and the fact that it's not placed on a statutory footing in this. And I'm just wondering, could you give us an update? I'm aware you are waiting for other places that are sitting in terms of the Department of Education, but could you give us an update on the thinking around that? Thank you.
Yes, we did consult on this, and overall the responses were supportive of us placing or establishing a regional children and young people strategic partnership on a statutory basis. However, it is cross-cutting in nature, and it certainly for us to do this, as we just started to try and draft instructions to Council, it did become clear that it would require significant amendment to the Children's Services Cooperation Act.
I think Julie's frozen from my end, Chair.
Yeah, I think Julie has frozen there. I'm not sure how. I think she was almost completed. Could we ask for that answer to be completed in writing, Paula?
That'll be grand. Thank you, Chair. Thank you, panel.
Yeah. Okay, thank you. So I'll move. So I have Carol then, and then Jerry. So go ahead, Carol, please.
So thank you, panel. My questions are in relation to 132 advocacy services, and it kind of ties in with what Paula was saying, but just in terms of you could just maybe even follow up in writing about the advocacy of children and young people who, are going to be adopted and even pre-adoption, so it's looked after, kinship, foster care. And then my second question is in relation to private adoption agencies. So while I appreciate you've got a definition of a privately fostered child, and that's in 139, and it goes right through to 140, I would like to have a greater explanation of what private fostering means, and if it does include religious orders, all adoption agencies, including regional authorities, are following the same criteria and guidelines and instructions. So that's my questions, Chair.
Thank you, Carol. Yeah, so I'm checking who in the panel can pick up on that. I think we've lost Julie. Francis, would it be yourself?
Yes, briefly, Chair. Private fostering is quite different, obviously, than adoption, and private adoption is really not permitted anymore. Private adoption agencies. There are some registered voluntary adoption agencies that have to be registered with RQIA, and as far as we're aware, they are not at this stage linked to specific religious groupings. As I said, there are 3 of them. The issue of private fostering being strengthened is it's quite difficult in that it obviously allows for parents to place children on a fostering basis directly with non-relatives It's not a private fostering arrangement if it is, with a relative. So this is really, it is quite difficult, I suppose, to grasp, for the public to grasp the difference. And this is why we really feel we need to, I suppose, highlight and create much better information about private fostering and when it should be reported. And that's one of the aims of what we're trying to do in the bill.
I can come in on the advocacy question, Chair, if that helps.
Yep, thank you, Liz.
Well, the bill does place on a statutory footing now advocacy services for looked after children, former looked after children, and those in receipt of special guardianship or adoption services. So that will be a way of supporting them if they wish to make representations or a complaint in relation to any service they've received. And this is part of the overall ethos of the bill, of supporting children's right to be heard in compliance with, the UN Convention on the Rights of the Child. So running through the bill, there is a thread of sort of listening to the rights of the child, ensuring that where appropriate, that informs the decisions that are made, and the advocacy services are a central plank of that.
Chair, could I just ask for in writing, just for follow-up? So in relation to that advocacy on the statutory footing, then where does that fit in terms of private fostering or for children who are being fostered or adopted indeed in another jurisdiction?
Well, certainly for a looked after child, in fostering, a looked after child will have the right then to make complaints or representations, as will a child who had previously been fostered and has left care. In relation to, so where, for example, also a decision is being made in relation to the adoption of a child in any circumstance, the new checklist that is being introduced in the bill will require again courts to sort of take into account a children's views when making decisions that affect them. Perhaps one of the other colleagues would like to add.
Again, we're really hopeful that for children being placed for adoption, wherever that might be, that the bill will add a real strength to that advocacy, provision of advocacy. So, we're hoping it should include, the advocacy will include those children who, are to be placed for adoption wherever, and also who have been adopted. So we're hoping it's a real strength to the provision of advocacy services for children who are looked after on the edge of care and who are to be adopted.
Thank you, and we look forward to receiving that written further detail in writing as well. Thank you, Carol. Jerry, go ahead, finally.
Thanks. I know time's tight, but I have 4 quick questions. In regards to the due consideration to the child's religious persuasion, racial origin, etc., what would be the changes implemented from this bill in terms of what currently happens? Second question, in regards to clause 10, mentions RQIA involvement. What changes would be implemented in terms of what RQIA does now currently and will do after this bill is implemented, and then 2 follow-up questions after that. Thank you.
Okay. Apologies for earlier on, my system completely crashed. As I said before, the religious persuasion, the Trust will be required to give due consideration to the religious persuasion of a child as part of, in any matters relating to adoption, particularly when considering the matching of children with prospective adopters.
Sorry, I'm just going to interrupt you, Julie.
In relation
Julie, sorry to interrupt you, Julie. We can hear someone moving papers around there, so I just want to check that everyone is on mute, because it's interfering with your sound a wee bit, which is a wee bit poor still. But go ahead, Julie, with that in mind. Thank you.
Okay. In relation to clause 10 and RQIA, that is that covers the management, the registration of adoption agencies with RQIA, and currently we have 3 adoption agencies now registered with them, and the arrangements really won't change. We're simply replicating the powers in the bill. So RQIA will continue to undertake the same functions as it currently does in relation to adoption agencies.
Okay, no change then. That's important or useful. Another question, clause 14 talks about inspections and reasonable time and right to request reasonable assistance. I mean, it sounds, excuse the language, reasonable, but I mean, is there a concern here that, in the case of negligible behaviour, that there could be a delay in terms of how quickly the department or RQIA could inspect or get access to buildings, venues, or anything like that? So just that jumped out at me. And then finally, clause 39, living with adopters before application, subsection 3, there is, sorry, apologies, 3, there's a period of 1 year in the case of non-agency applications by authority foster parents, and 3 out of the last 5 years in any other non-agency cases. That 3 out of the last 5 years, who would that apply to specifically?
Okay. In relation to the access by RQIA, are you meaning about any delay with access on what grounds?
Yeah, just in the fact that, reasonable time, what's reasonable to one person may not be reasonable to another, and it's open to possibly interpretation as I have read it. So is there a concern with the word not being more robust, that there could be a delay in terms of somebody could refuse access to the department or RKIA on that basis?
We wouldn't anticipate any problem or any significant delay with that. It's I actually would need to consider that one further. It's not something I can answer.
Clause 14, if we could get something.
So certainly we would, Francis, unless you have anything to add on that, it might be something we need to follow up afterwards.
Okay.
I think it's probably best to follow it up in writing afterwards, Julie.
Okay. And in relation to your last question about non-agency cases where 3 out of the last 5 years, Francis, would you be able to give an example of the types of?
Okay, these could be private foster parents. They could also be, as we've considered earlier, informal kinship placements, and also they would be possibly step-parent applications. The move for 1 year is really for, I suppose, foster parents who are registered foster parents with an agency. So that is decreasing from 3 years to 1 year. It doesn't have to happen in 1 year, but it does allow, if foster parents are really sure that they would like to apply to adopt this child and the circumstances are available, they can make that application in a shorter period of time. And obviously that is the merit of great security for the child concerned, because they will know that they are going to be living with those foster parents under an adoption arrangement and a permanent arrangement for life.
Thank you.
Okay, I want to thank you, Julie and Francis and the rest of the team there for your presentation and answers, and for your commitment and undertaking to provide additional information in relation to some of the areas that we didn't get full information on, and also looking forward to a timely response on that issue around the north and how that will work north-south. So thank you for that, and I appreciate your attendance today. We will obviously be talking to you again over the course of this very, very large and very important bill. Thank you. Okay, members.
Thank you.
Thank you.
Thank you, everyone. Take care. Right. So, members, we are moving on then to any other business. Do members have any other business today? No, and in that case, then members.
Sorry, Chair.
Go ahead, Carol.
Do we have any idea when the neurology inquiry team will visit or be brought onto committee?
I think the clerk will work on scheduling that probably at the earliest possible instance. I think it would be useful if we received a written briefing as well to inform that discussion. But I think we'll be looking at via the clerk and the inquiry at the earliest convenience. Yeah. Thank you. Okay. Thank you, members. Yes. Go ahead, Paula.
Just to clarify, there was quite a number of questions that were asked. Where the Health Minister or the CMO were not able to provide a full answer. Are they going to be recorded and submitted for a response?
Yes.
I'm just conscious that some of the issues that I would like to go back to constituents on.
Yes, the clerk has been noting extensively there throughout the meeting, actually, in all of the sessions, and those will be communicated. And if you wish to we can check that and make sure that everything is covered.
Certainly happy to take anything else, but we do take a note of what they've said they'll come back on, and we do a follow-up letter, to request the information.
Yeah, if you want to ensure your issues or any other member's issues are with the clerk, then to facilitate him in terms of that onward, that's fine as well. All right, Paula.
Okay, I'll send a separate email then. Thank you, Chair.
Thank you, Paula. Any other issues then, members? No, well then I'm moving, and thank you for your attendance and your deliberations today, members. But moving to date, time and place of next meeting. Our next meeting will be on Thursday, 7th of October, either in the Senate or by Starleaf as chosen by members. So thank you for that, members, and good luck. Take care.
Thank you, Chair.
This is the Northern Ireland Assembly Senate Chamber programme signed.